नमस्कार। आज अधिवक्ता परिषद हरियाणा के अभ्यास वर्ग का द्वितीय दिन है और आज का पूरे वर्ग का चौथा सत्र आज हम प्रारंभ करने जा रहे हैं। आज के इस सत्र का जो मुख्य विषय है वो है मेडिकल जूरिस्प्रूडेंस और मेडिकल एग्जामिनेशन। इसमें आज इस सत्र में हम 3 टॉपिक्स को कवर करेंगे, जिसमें सबसे पहला टॉपिक रहेगा मेडिकल नेग्लिजेंस, दूसरा टॉपिक रहेगा मेडिको लीगल रिपोर्ट्स और तीसरा टॉपिक पोस्टमार्टम रिपोर्ट। आज हमारे साथ जो ये टॉपिक्स पे हमें ध्यान देने आए हैं उसमें हमारे साथ बहुत ही विशिष्ट अतिथि हमारे आ चुके हैं। मैं आप सभी को कहूंगा कि एक बार तालियों के साथ हमारे अतिथिगणों का स्वागत करें। मैं प्रधान जी और चंद्रपाल जी से गुजारिश करूंगा कि वो डॉक्टर गुरमनजीत राय मान जी को व डॉक्टर राजेंद्र कुमार सैनी जी एवं डॉक्टर मुनीश शर्मा जी को स्टेज पर लेकर आए।
बाकी नाम भी बोल रहे आप।
इसके साथ साथ हमारे साथ श्री लोकेंद्र राघव जी हैं। मैं उनसे भी कहूंगा कि वो स्टेज पर विराजमान हो। माननीय सुशील जी, जगरूप जी, रविंद्र बुधवार जी अगर हैं तो, श्री बलबीर पोसवाल जी संरक्षक हैं पलवल इकाई के, और अनिल लाठर जी, आप सभी को मैं इस मंच पर आमंत्रित करता हूं। अभी मैं परिचय के लिए नितेश बंसल जी को आमंत्रित करूंगा कि वो आए और हमारे स्पीकर, हमारे अतिथिगण जो हैं उनका विशिष्ट एक परिचय दें।
धन्यवाद जी। मैं हमारे बीच में आज जो एक्सपर्ट्स हैं मैं उन सबका परिचय आप सबसे करवाना चाहता हूँ। सबसे पहले श्री गुरमंजित राय जी, इन्होंने 1998 में आपने मैनेजमेंट ऑफ विक्टिम ऑफ टॉर्चर के टॉर्चर काउंसिल के रूप में कार्य किया है। इसके अलावा सन 1994 में इंडियन एकेडमी ऑफ फोरेंसिक कॉन्फ्रेंस में ट्रेजरर भी रहे हैं। इसके अलावा कई अलग अलग स्थानों पर भी ये समय समय पर अपनी सेवाएं देते आए हैं। ये आप एडिशनल प्रोफेसर फोरेंसिक मेडिसिन एंड टेक्नोलॉजी जीएमसी अमृतसर में 2011 से 2017 तक रहे हैं। इसके अलावा इन्होंने अन्य कई शैक्षिक संस्थानों पर भी कार्य किया है और वर्तमान में आप फोरेंसिक मेडिसिन एंड टॉक्सिकोलॉजी के में प्रोफेसर एंड हेड हैं एट MMIMSR मुल्लाना। श्री राजेंद्र कुमार सैनी जी, आपके पास 12 साल का एक्सपीरियंस एज ASMO गवर्नमेंट ऑफ हरियाणा का है और वर्तमान में मेडिको लीगल एक्सपर्ट के रूप में अपनी सेवाएं दे रहे हैं एट सिविल हॉस्पिटल पंचकुला। श्री राजेंद्र सैनी जी की अगर शैक्षणिक योग्यता की बात करें तो ये आप MD फोरेंसिक मेडिसिन एंड टॉक्सिकोलॉजी हैं। श्री मुनीश शर्मा जी, आप असिस्टेंट प्रोफेसर एट डिपार्टमेंट ऑफ फोरेंसिक मेडिसिन MMIMSR मुलाना है और आपकी शैक्षणिक योग्यता MBBS.MD फोरेंसिक मेडिसिन एंड टॉक्सिकोलॉजी है। श्री सुभाष शर्मा रतगल जी
अभी आए अच्छा
श्री सुभाष शर्मा रतगल जी को मैं आमंत्रित करूंगा, कृपया मंच पर आए और अपना स्थान लें। श्री सुभाष शर्मा रतगल जी के बारे में मैं आपको संक्षिप्त परिचय दूंगा। आपका जन्म कुरुक्षेत्र के रतगल गांव में एक कृषक परिवार में हुआ। आपकी शिक्षा कुरुक्षेत्र यूनिवर्सिटी से हुई और आपकी खेलों में शुरू से ही रुचि रही है। आप कुश्ती के नेशनल प्लेयर रहे हैं और 1976 में आपने वकालत की शुरुआत की और नॉर्थ हरियाणा के बहुत से चर्चित केसों में आप बचाव पक्ष के वकील भी रहे हैं। समझौता ब्लास्ट में आप बचाव पक्ष के लॉयर रहे और आपकी टीम की मेहनत से आरोपी दोष मुक्त हो पाए। आप नॉर्थ हरियाणा के 8-10 बेस्ट केस में क्रिमिनल लॉयर भी रह चुके हैं और नॉर्थ हरियाणा में एज ए बेस्ट क्रिमिनल लॉयर आपकी पहचान है।
धन्यवाद नितेश जी। अब जैसे कि हमारी परंपरा है कि हमारे जो भी अतिथिगण आए हैं उनके स्वागत के लिए मैं आमंत्रित करूंगा। पंचकुला से राजेश कौल जी अध्यक्ष हैं हमारे, और अंबाला से केशव जी अगर हैं तो वो आए और डॉक्टर गुरमंजीत राय मान जी का स्वागत करें। माफी चाहूंगा, एक चीज शायद मेरे से ही गलती हो गई और मैं भूल गया कि हमारी आज का दीप प्रज्वलन नहीं हो पाया है, तो बात में करेंगे जी। मैं राजेश कौल जी से और केशव जी से कहूंगा कि वो श्रीफल और स्कंद वस्त्र देके हमारे डॉक्टर साहब का स्वागत करें। नारनौल से मनीष जी और यमुनानगर से गुलाब जी से मैं निवेदन करूंगा कि वो आए और डॉक्टर मुनीश शर्मा जी का स्वागत करें। इसके उपरांत साथ ही अशोक जी चंडीगढ़ इकाई से तो अध्यक्ष हैं, और भिवानी से गणेश बंसल जी आए और वे डॉक्टर राजेंद्र कुमार सैनी जी का स्वागत करेंगे। इसके साथ ही करनाल से सिद्धार्थ जी और पानीपत से राजेश शर्मा जी से मैं अनुरोध करूंगा कि वो आए और सुभाष शर्मा जी का वेलकम करें। बहुत बहुत धन्यवाद। जैसा कि आप सभी को याद है कि मेडिकल एग्जामिनेशन में बहुत सारे अलग अलग तरह के टॉपिक्स हैं, लेकिन आज हम उनमें से कुछ ही टॉपिक्स को कवर कर रहे हैं, जिसमें कि मेडिकल नेग्लिजेंस, मेडिको लीगल रिपोर्ट्स और पोस्टमार्टम रिपोर्ट से संबंधित जानकारी आज हमारे सभी डॉक्टर साहब देंगे। सुशील जी हमारे बीच आ चुके हैं। मैं आग्रह करूंगा सुशील जी से कि वो भी मंच पर आए। मेडिकल एग्जामिनेशन में हमें सभी को ज्ञात होगा कि लगभग दो टाइप के केस आते हैं, एक इंजरी केस आता है और एक अननेचुरल डेथ से रिलेटेड केसेस आते हैं। तो जहां पर इंजरी रिलेटेड केस हैं वहां पर एमएलआर बनती है, और जहां अननेचुरल डेथ का कोई भी केस है उसमें पोस्टमार्टम रिपोर्ट बनाई जाती है। उसी संदर्भ में किसी भी इंजर्ड व्यक्ति को किस स्थिति में हॉस्पिटल में लाया गया है, उसकी एग्जामिनेशन कैसे करनी है, और क्या उसमें क्या इंजरी है, उसको इंजर्ड करने के लिए क्या वेपन यूज किया गया है, उस सारे को कैसे एग्जामिन करना जाएगा, और उसको आगे बढ़ाते हुए कि उसका एग्जामिनेशन कैसे किया जाएगा, कि ताकि उसको कल को कोर्ट में कैसे प्रूव किया जाए ओरल एविडेंस के माध्यम से, वो सारा एक बहुत ही महत्वपूर्ण अंग है। तो अब ज्यादा टाइम ना लेते हुए मैं मेडिकल नेग्लिजेंस की टॉपिक के लिए डॉक्टर मुनीश शर्मा, असिस्टेंट प्रोफेसर, डिपार्टमेंट ऑफ फॉरेंसिक मेडिसिन, मुलाना, से गुजारिश करूंगा कि वो आए और अपना
So good morning all. So today I got the honor to start the first talk of the day of this session. So that is regarding medical negligence. So I'm going to give you a overview of what medical negligence is all about and what are the litigations, what are the common negligence cases, which are the examples of negligence cases which occur in daily medical practice. And then in the last, I am going to discuss some landmark judgments given by the Honorable Supreme Court of India in some important medical negligence cases regarding what are the guidelines, how we to proceed with those cases. So now first is introduction. What is medicine? So medicine, as a doctor, we feel that can we do this with our patient? But then another question that comes in mind as a doctor is, what is ethics? So that ethics is all about that should we do this to our patient? So in a nutshell, the ethics means doing what is right for my patient. So doctor is bound to do what is right for his patient.
देखिए कोडलेस जिंदगी की बात कोडलेस माइक दे दीजिए कोडलेस दे दीजिए
we can start. Next. Next. So I was saying at this that medicine is all about that for a doctor, can we do this to our patient? But ethics is about, should we do this to our patient? Because while treating the patient so we have to do what is right for that particular patient. So next, on the component of medical ethics. So the components include the physician has a relationship with the patient. So it also includes the relationship of a physician with the other physicians. The ethics also includes the relationship of a physician to the system of healthcare in India, and the relationship of physician to the society at large, and the relationship of physician to the legal system. Next. So the Declaration of Geneva, that is of World Medical Association, that binds the physician with these words, that health of my patient will be my first consideration or foremost priority. And the International Code of Medical Ethics, it declares that a physician shall act in the patient's best interest while providing medical care to his patients. Next. So now coming to the topic that there is a term that is known as medical malpractice. So what is medical malpractice? So this term, it is an umbrella of term which covers all the failures in the conduct of doctors, where it impinges upon the professional skills, ability, and his relationship with other colleagues and patients. And this medical malpractice, it can be divided into two broad types. First is professional misconduct, and the second one is medical negligence. The professional misconduct is here the personal or professional behavior of doctor that has fallen below, when it falls below which is expected of a doctor of repute in the society. And the second is medical negligence. Here, the standard of medical care given to the patient by that doctor is considered inadequate. Next. So, the Medical Council of India, under Indian Medical Council Acts, made the regulations which are known as Indian Medical Council Professional Conduct Etiquette and Ethics Regulations of year 2002, which are later amended in 2009 and 2020. Then there is a code of ethics as well. When we are, after finishing our MBBS course, when at the time of registration as a registered medical practitioner, all the doctors, they are self-warned about certain unethical practices which comes under infamous conduct, and the disciplinary action which can be taken by the State Medical Council, which is also known as warning notice to that doctor. And at the time of registration, all the doctors, they certify that he or she has read and they agree and they will abide by the same throughout their career as a professional doctor. So now coming to what are next? What are the rights and privileges of a registered medical practitioner? The first right is each doctor has a right to choose his patient. He may refuse treatment to any patient without any reason, but he cannot refuse or he should not refuse emergency treatment to a patient. Suppose a patient is coming
for some emergency services, then he doesn't have a choice that whether he can treat him or not. Then second is, each doctor, he has a right to use his title and description of his qualifications to add to his name while practicing. Then he has a right to practice medicine, right to dispense medicine to his patient. He has a right to possess and supply some dangerous drugs to the patient with some restrictions. And he has a right to give evidence. That's a right or privilege in some circumstances, to give evidence in the court of law as an expert witness. He also has a right to issue medical certificate, sickness certificate, fitness certificate, and medico-legal reports to his patients. And he also has right to recovery of fees for providing his services. So that's why medical profession is also covered under in Consumer Protection Act. Next. Then what are the rights and privileges of a patient? So like doctor has his rights and privileges, there are rights and privileges of patients as well. The first and foremost is access. The patient has access to healthcare facilities regardless of his age, sex, caste, creed, religion, or socio-economic status. He has a choice, like doctor has a choice to choose his patient. Similarly, patient has a choice to choose his own doctor freely. So then complain. So patient has a right to complain for his grievances to appropriate authorities. Then confidentiality. That is a very important privilege of a patient, that all information pertaining to his illness, that should be kept confidential. So doctor cannot reveal this information by the doctrine of professional secrecy. But there are some circumstances due to doctrine of privileged communication where he sometimes may share it with the higher public health authorities. Then dignity. The patient has to be treated with care, compassion, and respect by the doctors. Next is information. The patient should receive full information regarding his illness. That I have these ailments, these are the treatment options, or these are the treatment plans that my doctor has for me. These are the side effects of those. These complications can occur. And if there is any alternative therapy for the same illness, then the doctor has to inform his patient that you may, if you want, you can, these are the alternative therapies for your ailment. Then right to refuse. The patient can refuse any treatment or all treatment at all treatment measures if he feel like, because as per the doctrine of autonomy. So he has the autonomy of over his body. So he has the right to refuse all the treatment. Then records. The patient, they can have access to his treatment records. Next. Now medical negligence. So they say a doctor must possess a reasonable degree of skill and proficiency and apply that proficiency with a reasonable degree of diligence while dealing with his patient, while providing them care. The failure on the part of doctor to provide medical services with required skill and care, it gives rise to actions against the doctor under medical negligence in criminal, civil, or consumer courts. Next. So, a doctor is considered negligent if he does not offer his services to a patient in an emergency situation. But in case of emergency, the consent of the patient can be applied where, by the law, in those circumstances, suppose somebody has met with an accident and he is bleeding, so he requires immediate surgery and he is unconscious, he is going into shock because of blood loss, and the doctor need to operate upon him to remove, say, his one organ, so the spleen. So in that emergent situation, the patient is in unconscious situation, no guardian is there because some good Samaritan or some police officer has brought him to the emergency of that trauma center. So the doctor, what he will do in order to avoid in order to save his life. So the doctor, the consent is implied in that case. The doctor can operate upon him. And he won't be negligent without consent because the consent is considered implied by law in that scenario. Then the clinic, but the important part is for doctor to remember that although he has legal duties to perform in the emergency, but the treatment part, that is the clinical management, it should always precede the legal duties in trauma patients who are brought for the treatment, because we have to save his life first. Next, so the negligence, it consists of two parts. So two acts. One is act of omission. That means the doctor has not done something. That means not doing something that a reasonable man under those circumstances would do. For example, suppose somebody, an injured patient comes to me as a doctor, and then I am supposed to give him tetanus toxoid injection, but due to act of omission, I missed giving that, and he later on developed tetanus. So that will act as an act of omission on my part. Then second is act of commission. Act of commission is doing something which is which a reasonable, prudent man would do under the circumstances would not do. So that means he has committed something, means like operating on the wrong limb. So so he had to operate on the right and he has operated on the left limb of the patient. So that is an act of commission on the part of doctor. Next. So now medical negligence is of two types. One is civil negligence and another is criminal negligence. The civil negligence, it involves those acts on the part of treating physician which cause some suffering, harm or damage to the patient. And in this, the damage is of such gravity that it can be compensated by paying money to the patient. And these cases, they do not come under the purview of CRPC and IPC, and these does not demand any legal punishment for the doctor. And the question of civil negligence arises in which scenarios? The first is, suppose when a patient, or in case of his death, any relative of that patient brings a suit against the doctor in a civil court for getting the compensation from his doctor. The first scenario is that, because that patient has suffered injury due to the negligence of that doctor. And the second is when the doctor brings a civil suit for getting fees from the patient or his relatives who refuse to pay him the same, because he has provided him his services, and they refuse to pay by alleging medical negligence from the doctor. Next. The next is criminal negligence. Criminal negligence is more serious. These cases are more serious than civil negligence. What a criminal negligence is? For an act to amount to criminal negligence, the degree of negligence, it should be of higher gravity. It should be gross or very high degree. There, the physician has showed gross incompetency on his part and inattention in selection of his treatment modalities. And this is practically limited to all those cases in which the patient has died due to negligence of the doctor. Next. So what are the sections of Indian Penal Code that deals with? You all are way aware about these. Then so next slide, please. So the section which deals with the medical negligence is section 304A of Indian Penal Code. So it deals with criminal negligence. It says, whoever causes the death of any person by doing any rash or negligent act note amounting to culpable homicide, so is punished with imprisonment up to 2 years with or without fine. And if death is known cause to the patient, then the doctor can be charged under section 337 and 338 of Indian Penal Code. The 337 states that causing harm by rash and negligent act to endanger life, for which punishment is imprisonment up to 6 months and or fine of rupees 500. And section 338 IPC says that causing grievous harm by the rash and negligent act to endanger the life, for which punishment is imprisonment of up to 2 years and or fine of rupees 1000. Next, please. So what are the various examples of medical negligence? So before that, a physician can be liable for both, I told you, civil and criminal negligence even by a single act. For example, if a doctor has performed an unauthorized surgical procedure on a patient without his consent, so he may be sued in the civil court for the damages, for getting the compensation, and prosecuted in the criminal court for the assault on the patient. So it is, and now coming to the examples of various medical negligence. So it is impossible to give a complete list of negligent situations in medical practice, but some which are giving rise to allegations of negligence. So here you can see, next slide please. So these are the common errors which occur, like the doctor has operated upon the wrong patient or on the wrong side, or he has put the tight plaster cast over the limbs of the patient, which led to the paralysis of that particular limb. Or the examples of this medical negligence cases also include the death which occurs on operating table as a result of anesthetic overdose, or transfusion reaction deaths. They are also included in this. Then if a doctor has operated and removed a wrong organ, or he has removed a wrong say finger, or he has operated upon the wrong finger. Then the next is, suppose a patient comes with fracture and the doctor has failed to get his X-ray done. So that's a clear-cut negligence on the part of doctor. Or while operating upon the patient, the doctor has left swab or scissors or any other instrument inside the abdominal cavity of the patient. Next, please. So the burden of proof in negligence cases lies on whom? So whenever a lawsuit of medical negligence occurs, the patient in those is known as plaintiff because he is pleading, and the physician here has to defend him. So he becomes the defendant. So the accused doctor is considered as innocent until proven guilty, and the prosecution must prove the case against the doctor. So the whole burden of proof, the patient and plaintiff, he bears the burden of proof in a medical negligence case. There are some exceptions of res ipsa loquitur, on that I'll come later on, where doctor has to do that. Then coming to the next slide, please, next slide. That is, what are the 4 Ds? That means the medical, while then the burden of proof lies with the patient, so then he has to prove, he requires to establish these 4 Ds in order to prove that this is a case of medical negligence. The first is the duty, that the patient was in doctor-patient relationship with the doctor, and the doctor owed a duty to treat the patient. So there was existence of physician's duty to take care of the patient. The next is dereliction of duty. That means there is a breach in the duty which is caused by the doctor's negligent act. So that because of that dereliction of duty or breach in the duty, so that duty that is caused by the negligent act or omission on the part of doctor, that has led to this dereliction of duty on the part of doctor has led to the damage. that is pain and suffering to the patient, or can lead to disability and disfigurement, lost wages, and in some instances even wrongful death of the patient. And then last D is direct causation. That means there is a direct link between the doctor's negligent act and the injury suffered by the patient. So these 4 Ds have to be established. So to prove a case of medical negligence, that is, doctor owed a duty to the patient. There was dereliction of duty on the part of doctor, which has caused damage to the patient, and there was direct causation between that injury suffered and the negligent act on the part of doctor. So now coming to next, what are the defenses against negligence? So the doctor has various defenses which he can use. There are various scenarios which he can where he can defend himself against a medical negligence, the case of medical negligence. First is, if the doctor can establish that he was not in the doctor-patient relationship with that patient, with that particular patient. That means he owed no duty to treat that particular patient. First point. The second is, suppose the doctor had duty, but then he can say that I discharged my duty according to the prevailing standards in that particular circumstance. So that can also act as a defense. But the important plea that a doctor can take, that is informed consent. So informed consent for the act. So what is informed consent? So the patient, whenever he comes to a doctor, say a surgeon, for getting a surgical procedure done, then the doctor is bound to tell him in detail that you have this particular illness, I am going to operate upon you. These are the these are the surgical modalities which are available to you, and I am going to do this and this for you. And also he need to tell any side effect or any complication. So he has to tell in detail what he is going to do and what are the side effects, what are the complications that can occur in near future, or he also need to tell any other alternative modality which are available for his treatment. So that means the patient has been fully informed about his illness and the treatment options that are available to him. Only then the patient is going to sign that consent form. So the doctor, if he has taken a fully well-informed and written consent, that can also act as a defense in negligence cases. Then, if the doctor can prove that patient was guilty of contributory negligence. What is contributory negligence? It means the patient has contributed to that negligence. That is, that there was unreasonable conduct or absence of ordinary care on the part of patient or his attendant, which combined with the doctor's negligence has contributed to the injury. Say the patient comes to the doctor and doctor advises him, you have to, suppose he is a diabetic patient and doctor advises him, you have to take a diabetic diet, but the patient doesn't do that. So, and in this scenario, the doctor has to prove the patient's negligence. And there, the damages awarded by the court, they may be reduced because here the patient is also negligent along with the doctor. Next, please. There is a doctrine of therapeutic misadventure. What is therapeutic misadventure? It means the patient here has been injured or died due to some unintentional or unintended act by the doctor or hospital. So here, the injury or an adverse event, it is caused by the either it is caused due to medical management. So it includes medication errors, medical and surgical errors, iatrogenic or nosocomial, that means hospital acquired infections, or any post-operative complications which occur during the stay of the patient in the hospital after operation. And these mishaps, they do not provide ground for negligence. So that's why it acts as a defense against the negligence. The examples are hypersensitivity reaction caused by the antibiotics like penicillin or tetracycline, or The doctor is doing barium enema and the patient has developed chemical peritonitis. So that is a inflammation of peritoneum due to that. Then the patient is taking, say, iodine therapy, and the doctor has developed, the patient has developed thyroid cancer out of that. Or the patient is taking a synthetic estrogen therapy, and that the doctor has prescribed him for some other ailment, but that has caused breast cancer to the patient. So all these comes under therapeutic misadventure. So the next is res judicata. The res judicata, it means that the things they have been decided. So according to this principle, the case between the two parties has already been, once it has been completed, then it cannot be tried again between the same parties. That means suppose a patient has sued a hospital or doctor for negligence and the patient loses that case. So in that case, in the district commission, then he can appeal to the state commission, national commission, and finally to the Supreme Court. Once all this process has been done, after getting the decision from the Supreme Court, then he cannot lodge a fresh complaint for the same negligence in the lower court. Next. So that is res judicata. Then mistake of fact. So it is a particular situation where the person, when the doctor is not intended to do unlawful act, but he does so because of some wrong understanding or wrong conclusion of the fact. Here, this act as a defense because the doctor was not of any guilty mind while doing that act. So this can help in reducing the civil liability. The last is limitation. What is it? This means that whenever any negligence case against a doctor, that should be filed within 2 years from the date of alleged negligence. After that, that case won't be taken up. And suppose doctors say that I have not charged any fees, that no fees charged for the treatment, that cannot act as a defense in negligence cases. Next. There is a term that is known as res ipsa loquitur. So what is this doctrine of res ipsa loquitur? It says that the patient, normally the onus of the burden of proof lies with the patient in case of negligence. Here, the patient does not need to prove negligence. So what this term res ipsa loquitur means? It means the things or facts, they speaks for itself. So it applies in both civil and criminal cases. Here, the error of the doctor is so self-evident that the patient's lawyer, he need not to prove the doctor's guilt with any medical evidence. Here, the doctor has to prove, instead the doctor has to prove his innocence in this case. So in such scenarios, the breach of duty by the doctor is so obvious. So the strategy of the doctors, because here he is defense, it is generally must to show that the patient was not harmed by his breach of his duty. In order to apply this rule, the 3 conditions should be satisfied. That means the first is, in the absence of negligence of that doctor, that injury would not have occurred. Then second, the doctor had exclusive control over the injury producing equipment or treatment. Then the patient was not guilty of any contributory negligence. So what are the examples of this res ipsa loquitur? That is the leaving, suppose a surgeon has left scissors or swabs in the abdomen of the patient after surgery, or doing a wrong side surgery. That means he had operated on the wrong limb or wrong person. Or I have given example that failure to give tetanus toxoid injection after injury, or loss of use of hand after doing prolonged plaster on that particular limb. So next is when this malpractice or negligence occurs. So I have told you medical malpractice occurs when the healthcare providers, they deviate from their recognized standards of care in the treatment of that patient. And who defines this standard of care? It is defined as what a reasonably prudent medical provider would or would not have done under the similar circumstances. So next please. So now a brief about this. After the Consumer Protection Act of 1986 had come into force, now the patients, they have filed legal cases against doctors in India as well. And they have established that the doctors were negligent in providing their medical services. And the commission has provided compensation for the same to the patients as well. So as a result of this, a number of legal decisions have been made that which constitute negligence and what is required to prove it. Next, please. So now, in the last, I'm going to discuss 2-3 landmark judgments of the Honorable Supreme Court regarding the cases of this medical negligence. The first is regarding this case was Jacob versus State of Punjab. So I'll tell you in brief what were the facts of this case. So what happened? A patient named Jeevan Lal, he was admitted in the Christian's Medical College, Ludhiana, in year 1995. So in the ICU of that ICU ward of that hospital, at 11 p.m. in the night hours, what happened? He suddenly developed difficulty in breathing. So the nurses, the attendants of the patient, they called upon the doctors and nurses. The doctor came up after 25 minutes. Then immediately the doctors put him on the oxygen cylinder, but his condition again deteriorated because the oxygen cylinder was empty. Then in the hush his younger son, he immediately rushed to the nearby ward and he brought another oxygen cylinder. In that time period of 5 to 7 minutes was wasted. And when he brought the oxygen cylinder back, till that time their father was expired. So aggrieved by this, the younger son filed an FIR against the treating doctor, Dr. Jacob Matthew, as per section 304A of IPC. So in that case, the landmark judgment of the Supreme Court of India came in 2005, and it laid down the guidelines to be followed in cases of alleged negligence against medical practitioners in India. The judgment of Supreme Court, it stipulates the guidelines which have to be followed before launching a prosecution against a doctor for negligence. And this judgment clearly stated that there is a need for protecting doctors. They are saying that doctors, being in a noble profession, so they say that they should be protected, and they are saving lives of the people, so they should be protected from the frivolous or unjust prosecution. So what this judgment says, they say that whenever a private complaint, like here they made a private complaint to the police against the doctor. So they said whenever a private complaint may not be entertained unless against the doctor, unless the complainant has produced prima facie evidence before the court in the form of credible opinion given by another competent doctor to support the charge of rash and negligence on the part of that accused doctor. So it says that the investigating officer that should, before proceeding against any doctor accused of rash or negligent act, he should obtain, first of all, an independent and competent opinion, preferably from a doctor in the government service, who is qualified in the same specialty of the medical practice, who can normally be expected to give an impartial or unbiased opinion in that particular case regarding the facts. And they also provided that a doctor accused of rash and negligent act, he may not be arrested in a routine manner simply because a charge has been leveled against him, unless his arrest is necessary for furthering the investigations. So that and taking this judgment forward, so they said that these are the guidelines for time being. Later on, each state and central government, along with the Medical Council of India, nowadays it is called National Medical Commission. So they framed guidelines. So taking that forward, the Governor of Haryana, he constituted a medical board in each district with the name of District Medical Board to examine the complaints of negligence against doctor. So, and this board consists of civil surgeon of the district as its chairman. Then there is principal medical officer or medical superintendent of that particular civil hospital as its member secretary. And then there are two subject specialists or the subject specialists, preferably either one from the government sector and one from the private sector. These are the two members of that board, and one member is from one member of District Indian Medical Association, IMA. So that is also a part of that particular district medical board. So anyone having grievances of medical negligence against any doctor or any hospital, they should write down to the member secretary of their district medical board. Then they can take up that case. So then the next judgment is regarding informed consent. So this was in Delhi, Samira Kohli versus Prabha Manchanda case. So Samira Kohli was I'm again telling you brief about this. She was a 44-year-old female. She was in her 40s. So what happened? She was having menstrual irregularities. She went to Dr. Prabha Manchanda and she advised her that on doing her scans, she said that you are suffering from an ailment called endometriosis, but I need to confirm it by doing laparoscopy on you. So under general anesthesia, she before doing procedure, she took consent, and then she performed laparoscopy on her. While performing laparoscopy, she was unconscious, and her mother was, as attendant, was sitting outside the operation theatre. So what happened? That doctor felt that her endometriosis is of that gravity that she need to take entire uterus along with ovaries and fallopian tubes out of the pelvic cavity of the patient. So, but the patient was unconscious, so she sent her subordinate doctor to the mother of the patient to take the consent. So, mother said, it's okay, you can do whichever you feel like to save my, which is good for the health of my daughter, you do that. So what she did, she operated upon her and removed her uterus along with the ovaries. And the Samira Kohli was not married at that time. So what happened? Once she regained consciousness, later on she filed a suit against Dr. Prabha Manchanda that she has removed my reproductive organs. She has taken the right from me the right to become mother. And second, because she has removed my uterus, so that has caused premature menopause to me. So for that, I need to take unnecessary hormone replacement therapy for a long duration. So then, so in that case, the Supreme Court came up with another landmark judgment in the year 2008, and Supreme Court stated that the consent which is given for a diagnostic procedure, it is not valid for therapeutic treatment. And the consent which is given for a specific treatment procedure, it will not be used for conducting some other treatment procedure. Even if it is beneficial to the patient, like it was here in this case, it was beneficial for her, but the Supreme Court overruled that. So because the National Commission ruled in the favor of Prabha Manchanda, but Supreme Court then overruled that, and they said because she had taken consent only for the diagnostic procedure. So how can she perform therapeutic procedure? The only exception to that is again the case of emergency. Suppose the patient is going to die out if he is not going to operate upon that her or him. So then you can do that. So exception is emergency. So the next is one last case is about this was case of Kunal Saha versus Emory Hospitals in Kolkata. So what happened here? Again, Supreme Court came up with a landmark judgment which made news in the entire medical fraternity as well as among Indians across the globe. What was the case here? So Kunal Saha, he was a medical doctor. He was a researcher there in living in United States, along with his clinical psychologist wife, Anuradha. So what happened? In 1998, they came here for a family wedding. They were well settled in the United States. They came here for a family wedding. She developed some rashes over her body. Then they went to the local doctor, Dr. Mukherjee. So he was a very renowned doctor of Kolkata at that time. So everybody down there was in awe of him. So he said that everybody recommended Dr. Mukherjee ke paas ja rahe ho, sab badhiya hai. So he said, okay, so he went to doctor, they both went to him. He prescribed high dose steroids to his wife. So that high dose steroid has reduced her immunity to that extent, and that has led to a condition known as toxic epidermal necrolysis. That means sloughing of skin of entire body. And he went to the doctor, and doctor prescribed medication, and he left for for his conference in United States. And then his subordinates were treating her. So he said that why doctor, because he was also himself a doctor. So he said, why you are prescribing such high dose of steroid to my wife? The doctor said, I have treated hundreds of cases like your wife for last 20 years. So don't worry, she will be fine. But she developed complication called as toxic epidermal necrolysis. Then he had to airlift her to Breach Candy Hospital in Bombay. There, after 10 days of treatment, she died. So then, because he was doctor, he said that I am going to prosecute these, and he pursued these cases for 10 years. Sorry. So what happened in 2009? The National Commission, so the National Consumer Dispute Redressal Commission, they awarded compensation of rupees 1,73 lakhs to him. So that was a very huge amount, first one in India of that much amount. But he was not happy with that. He went to Supreme Court. Then after 4 years, in 2013, in the highest ever compensations awarded by any medical negligence case, the Supreme Court, what they said, they asked Kolkata-based Emory Hospital and the 3 treating doctors to pay a whooping amount of 5 crore 96 lakhs, along with the interest because the doctor has lost his psychologist wife during their visit in India. So what happened? The Supreme Court bench, they raised the compensation from 1.73 crores to 5.96 crores. And they asked the doctors to pay the amount within 8 weeks, along with the interest rate of 6% from the date of filing the case in the year 1999. So that came as a landmark judgment, and taking glory from this later on, Kunal Saha, he made a portal. So now they are advising people about how to proceed in medical negligence case, and they have made a portal known as to treat people for better treatment. So this is the summary of details of compensation which they have given. They said because she was a qualified clinical psychologist, so she lost the income of the quantum of 5 crore 72 lakhs. Then the treatment for the medical treatment costed them 7 lakhs. Total expenses of their breakdown that 5.96 crores into this. So the pain and suffering, they know, I don't know how they calculate pain and suffering, but they've given 10 lakhs for that, and cost of litigation was 11 lakhs 50,000. But he pursued it, and now they are giving advice to the people for better treatment. So then last is, what are the methods to minimize litigations? So the doctor, first of all, should be aware of the potential areas of litigation and medical legal problems that can arise because law is also like medicine, like society, medicine, law, they all are ever evolving. So daily new cases, new judgments are coming up, so doctors should be up to date with his legal knowledge as well. So he should know the law of the land and legislation. Then second, he should always try to maintain a good relationship with their patient, because good rapport goes a long way. Because a suspicious patient who has no faith in his doctor, he is a potential litigant. Then the doctor should maintain minimum standard of services for their hospital, whether it's a public hospital or a private hospital. Then litigations can be minimized. And if the doctor, there should be adequate training of the medical nursing staff and maintaining time-tested, well-accepted protocols. That this is the case, we have to do this. So that helps to minimize litigation. Again, I told you, informed consent and proper counseling, it is mandatory before going for any invasive operative procedure. Surgical intervention, they should always be performed by the qualified staff, and if they have sufficient equipment in place to do the same. Then meticulous record keeping on the part of hospital and doctor, documentation, that's a very good method to minimize litigation. So that can prove the doctor innocent in the court sometimes. Then morbidity and mortality audits that can help in improving and maintaining the standards of patient care. Each doctor or hospital, they should have their medical indemnity insurance in place. And I think nowadays they also have big hospitals, they will be having their law teams, so medical defense lawyer. So they should have efficient defense lawyers attached to their hospitals who are aware of the expected standard of patient care which is prevalent in the society, and because that is important to defend a doctor against any medical negligence case or suit. So what to do when you suspect a case of medical negligence? So in United States, their record shows that after cardiac deaths, they are known as non-communicable disease deaths. Their data shows that the medical negligence is also, or medical error, they are also one of the leading cause of death in the United States. They have that data. But in India, no such study is available. But we all know that medical malpractice is rampant. We have seen in COVID, during COVID era just last year, what happened. So the medical malpractice is rampant, but we don't have our Indian data with us. In US, $3 billion compensation was paid, say in 2012 alone. So what to do when you suspect a case of medical negligence? You can file a complaint with the local police or state medical council and state consumer court. The police will send that complaint to the state medical council. If the medical council upholds that complaint, so then they will file a case under the relevant section against the doctor. And then case goes to the appropriate court, whether it's a civil or criminal. So if it's a criminal case, it becomes again the case of state versus so-and-so doctor or hospital. Also, the state medical council can also initiate action on its own against the doctor by suspending his license or removing his name, that is known as penal erasure, for a particular time period. If those charges they are upheld by the court of law, then the doctor can be arrested and jailed. If either party is aggrieved by the State Medical Council's decision, then he can appeal to the Medical Council of India. Also, the doctors, they can approach the patients, they can approach to the consumer courts for getting compensation for the doctor. If the complainant goes to the consumer form, so there a panel of medical experts will look into that, and if the complaint is upheld, the firm decides the quantum of compensation to be paid to the patient. Consumer firms, they can only decide compensation amount, but they cannot punish the doctor. And if anybody is unhappy with the consumer firm's decision, then they can appeal to the National Consumer Dispute Redressal Commission, NCDRC, and further to the Supreme Court if needed. You can also consult, I told you, patient advocacy groups like Dr. Saha's Peoples for Better Treatment. It is one such example, or other eminent legal experts who have knowledge in medical domain. So that is all about this. And lastly, I tell that they have given example of a sample state how they are doing in Delhi Medical Council. So which is one of the authorities. They are saying that they get 20 to 30 complaints of negligence, medical negligence cases every month. And what are these complaints? These are complaints regarding overcharging, lack of care on the part of doctor, wrong or unnecessary procedures being done on patients, incompetency on the part of doctor. And majority of these cases, they say they are dismissed. At best, they just issue a warning notice to the doctor. Not even a single doctor has ever been barred from the practice by the Delhi Medical Council. So that is the status of national capital. So we don't know what is the status here. So that is all about medical negligence. So I told you, we as a doctor cannot hide our negligence for long, because as the society is evolving, people are becoming more aware, technology is catching up. So we need to be vigilant, and we need to take proper care and give proper treatment with reasonable care and skill to the doctors. Thank you.
बहुत बहुत धन्यवाद डॉक्टर मनीष शर्मा जी। जैसा कि हम सभी जानते हैं कि हमारे इस कार्यक्रम को अधिवक्ता परिषद हरियाणा के ऑफिशियल यूट्यूब चैनल और फेसबुक पेज पर भी लाइव देखा जा रहा है, तो उस हमारे व्यूअर्स की तरफ से भी बहुत सारे व्यूज आपके अप्रिशिएशन के बारे में हमें मिले हैं। बहुत बहुत धन्यवाद। अब मैं आग्रह करूंगा डॉक्टर राजेंद्र कुमार सैनी जी से कि वो आए और अपना वक्तव्य प्रस्तुत करें। डॉक्टर राजेंद्र।
Good morning to all of you. Thanks to organizer giving opportunity to present in this your auspicious program. Today topic of the discussion is medical legal reports, and second topic is mechanical injuries. First, the medical legal case. A case can be defined as a case of injury or ailments in which investigation by the law enforcement agency are essential to fix the responsibility regarding the causation of the said injury or ailments. In simple language, it is a medical case with legal implication for attending the doctor, where the attending doctor, after eliciting the history and examining the patient, think that some investigation by law and enforcement agency is essential. Doctor and MLC. Every doctor and under law bound by contract to serve its patient and cannot refuse treatment. Every doctor has to fulfill certain requirements in service by compulsion or voluntary as defined under law. Medico-legal case examination and reporting is one of the legal responsibility of the all doctors working in hospitals. Why to manage MLC? Medico-legal cases are just as non-MLC sick injured patient and the doctor is duty bound to treat as well as document the details. It is a crucial piece of the evidence. The responsibility to label any case as a MLC rests solely on with the attending medical practitioner. Fear of the MLC. Every medical practitioner at any time during the practice of his profession, whether in a government setting or private one, would have encountered certain cases which at that given time subsequently would be labeled as a medical legal case. Many practitioners are usually apprehensive in dealing with these cases. These cases as they treat the MLC medical legal case means entangling in the police case, indefinite hour to spend in the court or facing defense counsel. Because of this fear factor, they either try to avoid the cases to try to manipulate them as a non-MLC. The best way to deal with these cases is to understand them clearly, analyze them thoroughly, and then act accordingly. Doctor working in a private hospital report sometimes there is a patient coming in the hospital, but the duty of the doctor is working in the private hospital. So the case of the poisoning coming in the private hospital, the duty of the doctor to inform the police. When the doctor sometimes the patient doctor did not inform the police regarding the poisoning case, the failure to do is punishable under section 176 of IPC. If the police require information, the doctor is bound to supply the information. Failure to do so is punishable under section 175 CRPC. False information given is punishable under section 193 CRPC. Receiving a MLC. A doctor can receive a medical legal case any of the following four situations. A case is brought by the police for examination and reporting or order of the court for medical legal examination. Second, the person in the question was already attended by the doctor and MLC was already registered in a previous hospital and the person is now referred for the expert management or advice. Third, when the patient himself expresses his intention to register a case against the alleged accused. Fourth, by the doctor himself after eliciting his history and examining the patient if he feels so that the case in accordance with the law of the land. In such situation, the doctor has to utilize the medical knowledge and judgment to decide whether the case should be treated as MLC or non-MLC, especially when the history is not completely revealed either by the patient or his relative or friend due to some motive. Example of the medical legal cases: road traffic accident, rail accident, factory accident, or any other unnatural mishap, suspected homicide, suicide, suspected or evident poisoning, alcohol intoxication, burn injury due to any cause or electrocution, physical assault cases, animal attacks, snake bites, mass food poisoning, cases of sexual assault, suspected or evident criminal abortion, injury cases where foul play is suspected, injury cases where likelihood of the death in the near future, unconsciousness cases where the cause of it is not clear, cause of death is not clear. Broad dead cases where the foul play is suspected, case referred from the court. These are the some examples regarding the medico-legal case. Broad dead cases, all the cases of the natural death like accidents, burn, violence and sexual assault, depending upon the history obtained from the relatives or the police accompanying the case, should be labeled as a medico-legal, and all the formalities must be done with informing the police constable on duty. In all the broad dead cases where the casualty duty officer is very much satisfied after taking the history and going through the report available that the death was natural as may not label them as medico-legal purely at his discretion. In the death certificate from the against the column of the cause of death, one should write not known broad death. In no cases it should be mentioned that cause of death should be determined after the post-mortem. Doctor making a MLC case is mere legal formalities. Even in a broad death case, it is practically impossible to diagnose cause of death or external examination history. It is for the police, being law enforcement officer, to decide whether it is a natural death or to submit the post-mortem examination to rule out. Many white doctors mention on record that came gasping and they have a diagnosed cause of death through case. It is broad death. It is calculated risk and the rather dangerous move, because if the case turn to the MLC, you will have to face legal action. Act as per law and inform the police, and do not be emotional and to be carried away from the emotional turbulence, psychological trauma, flight of relatives, humanitarian grounds. According to rule, you have to register it as a MLC and inform the police of all cases of death from the arrival, broad death to emergency and casualty. Tell the relatives attended the legal issue and tell them that it is better to intimate the police, and autopsy is to conducted to know the exact cause of manner of death. But along the legal requirement, we have to consider the humanitarian aspect from the patient, relative, attendant and point of view also. Practically, it is a relative request you to not to inform the police. Consider the age of the patient, old age, verify the history. First, to verify the history of the patient coming in the emergency regarding the type of injury, etc. Verify the previous medical report and discuss with the concerned doctor or the phone if possible. Examine the body carefully for injury, ligature mark or any such suspicious findings. If you are reasonably sure that no foul play is suspected, release the body and allow them to take certificate of the cause of death and or the regular medical doctors. Mention all the details in the hospital notes and keep all the reports, including the copy of the previous medical reports. Inform the police always, even though the relatives are requesting you not to inform all the cases of assault in emergency, death on arrival, broad death to the emergency and casualty. Suspect all unnatural death as per history, death of a recently married woman, young adult, young elderly with no proper medical record. If you find any injury, ligature mark, nails and the bite marks, sign of the poisoning, exercise your careful discretion in broad death in female, infant and mentally retarded. Alcohol and MLC. Drunken driving 30 milligram% level of alcohol, misconduct in public, mixed ingestion, Bombay Prohibition Act, and chronic alcoholic causing trauma related to head injury. Drunken state more prone for vehicle inhibition and sudden death. Hope tragedy. preserve 10 ml, preserve the blood of the patient in 10 ml blood in sodium chloride and potassium oxalate. These are the some. Next is the consent in the medical legal case. In the normally the patient coming in the emergency brought by the some relative or some person. Sometimes the patient of road traffic accident coming in the emergency brought by the some person. They left the patient in the emergency and after lefting the patient, they go outside. In these cases, the consent is important for medical legal case. Consent for the medical legal examination to be taken in written in all cases. Person below 12 years unsound mind, the consent of the guardian is to be taken. Consent not required. In some cases, there is no requirement of consent. In medical emergency, notifiable disease, immigrants, exception. Since exception are cases brought by the police being arrested on the charge of the committing offence, new admission to the prisons, court order for examination and treatment under section 53(1) of CRPC, person can be examined on the request of the police by the use of the force. Member of armed forces on request of competent authority in writing. Consent is not required for from relative in case of the conducting postmortem. There is the 2 points. Identification point must be noted during medical legal reports. 2 easily accessible identification point to be noted down in the MLC, like moles, scar mark, tattoo mark, some old deformities, and the thumb impression. This is for the sake of the identification of the person in the future as a court in a court of law. MLC should be registered as early as possible. There is no time limit for preparing the MLC and MLR or registering a case as MLC. A case which otherwise qualified to be an MLC was not registered earlier to be registered as an MLC by the concerned doctor. The case due to unraveling of new findings, history, clinical address, etc. Later on the qualified to be an MLC to be registered by the concerned doctor. Documentation of the MLC documentation is done in a duplicate in a set of forma. Today, the Haryana government have started the Medlic on the software Medlic regarding the online reporting of the MLR and PMRs. Today, all the reports are on the Medlic portal. No handwritten reports are admissible in the courts. Cutting and overwriting should not be avoided as much as possible, and all the corrections should be properly initiated. Abbreviation of any sort should be avoided. Separate pro forma may be available for medical examination of drunkenness, etc. All the columns are filled by carefully and by the same doctor who had examined the patient. Each MLC is given a fresh MLC number sequentially. The details are completed and then there leaving no provision had to be completed later on. Investigation advice and finding to be entered. All the investigation to be advised are entered on the MLR. The treatment given in the site on reporting. The opinion to be recorded in MLC sheet. If the opinion cannot be given under observation, be given and signed by the doctor with the name written in block letters. Final opinion given by the same doctor making MLC in the original MLC sheet after all the investigation are completed. After completion, the doctor must sign and mention his name in full below it with designation. Police constable on duty should be involved in each case. After registration of a case at MLC, thereafter all the document and registration form bear the same MLC number including the discharge slip. In some cases like firearm injury and rape cases accused of rape examined, we need the some sample and biological sample to be sent to the FSL regarding the biological specimen. In these cases, same MLC number should be written on all these letters to the FSL and other letters written to the FSL regarding the MLC cases. The patient is admitted or discharged with the advice to be entered in the case sheet. The doctors examining the patient must completely the MLC sheet before leaving the hospital. All MLC X-ray be kept in the department as evidence for the court of law. Special sample taken to be entered in the MLC sheet. If the patient is dead or died, handed over to the police for postmortem and not to the relative. A copy of MLC sheet should be handed over to the police for further investigation against his signature and batch number of the copy. The transfer of the MLC case. When sometimes the patient brought to the private hospitals, in that case MLC is paid by the private hospital. In that case, private hospital can refer the patient to the government hospital regarding the higher investigation and other investigation and specialist opinion. In that case, MLC is transferred from the private or other government hospital like PSC to higher center like general hospitals. That case is also called as a transfer of MLC cases. So these are the general details are noted during the medical legal cases. First is the registration number of the hospitals. This is then the MLC number, name, daughter of, age, sex, religion, occupation, residential address, brought by date and time of examination in the OPD, ward, emergency. Any of these are the places for the examination of the patient. Name of the police station. Detail of the examination. So in the medical legal reports, we have to mention the alleged history. In the alleged history, we mention the cases like the example of the accident case. We mention this is the case alleged history of road traffic accident on dated this date and this time in this place. This is the mentioning of the alleged history of the cases. To be precise and to the point. The alleged history to be in precise point and to the point, legible and clearly written, and this description of the injury. Then the column of the injuries. In the detail of the injuries should be mentioned in the medical legal reports. When about regarding consultation obtained, when there is any doubt regarding any injuries and the doctor wants to consult regarding higher opinion, doctor can advise higher opinion regarding the X-ray, ultrasound, surgical opinion, and ortho opinion, any other opinion. Minor injury also noted in case of the polytrauma or multiple injuries. Sometimes cases of the custodial torture are coming in the emergency. So many accused are arrested in cases of the theft and other cases. They are tortured by the police. But when the patient bring into emergency, some injuries are on the hidden part of the body are below the clothing. Sometimes these injuries are missed during the examination. Doctor should not ask the patient to remove the clothing, and doctor should examine all the injuries and detail of the injuries. There is the legal duty of the doctor is first to treat the patient. If there is any patient coming the MLC in emergency for medical legal case. First is the duty of the doctor to treat the patient, and after the treatment, the doctor had to perform all the legal formalities of the medical legal reports. Because of short of time, we have to we are discussing these reports in shortly. Time limit for registering MMIMSR. There is no time limit for registering a medical legal case. A medical legal case should be registered as soon as a doctor suspects foul play or feel it is necessary to inform the police at arrival. At any time after admission, there should not be any unnecessary delay in doing so. A case may be registered as an MLCM. It is brought several days after the incident is suspected. No MLC should be backdated. These are the, after noting the injury, there is a collection after there is a collection and preservation of sample. All the biological sample and other specimens should be collected by the doctor and labeled and sealed and handed over to the police for examination. Then the diet declaration. When the patient, some patients are coming into emergency in very critical situation, they are going to die. Then the doctor had to inform the police, and through the police, the doctor give information to the nearest magistrate regarding record of diet declaration. When the magistrate did not come on the time for recording for dying declaration, then the doctor can record the dying declaration in the presence of the police and the staff. When the doctor should mention the date, time, and detail of the dying declaration. These are the details of the. Second, we discuss the injury. The major part of the injury, major part of the MLC are the injuries. Some of the injuries mentioned on the medical legal reports. Sometimes our doctors miss some of the injuries, and our advocates are misinterpret these injuries on the. Here in this slide, we discuss in detail regarding the mechanical injuries on the body. See this. Please close the slides, then open the mechanical injury. Mechanical injury is the next topic. Close with the cursor on the right side. This is the mechanical injury. Medical jurisprudence. In Latin, juris means law, prudential knowledge. It mainly deals with the legal aspect of the practice of the medicine. It includes the responsibility of the doctors, deals with the doctor-patient relationship, medical negligence, professional misconduct, consent, and medical ethics. Traumatology. The branch of forensic medicine will deal with the study of the trauma and its effect on the human body is called traumatology. Important terms. Trauma is assault to the living tissue. It applies as well as to emotional or mental stress. Then injury. Any harm whatever illegally caused to caused to a person in body, mind, reputation or property. Heart. Whoever cause pain, harm, disease, infirmity or injury to any person or impaired or disable or dismember any organ of the body or part of any person without causing it, which that is said to be cause hurt. Assault. Any offer of threat or attempt to apply force to another in a hostile manner is called assault. Then wounds, a destruction of the caused by the application of the force to the body. Next, battery, it is the actual application of unlawful force to the body directly or indirectly. Then the classification of the injury. Various injuries are mentioned on the MLR. This is the classification of the injury on the basis of a weapon used. Injuries caused by blunt weapon. First is the bruise, abrasion, includes scratch, graze, imprint. Then laceration include evulsion, scratch and split. And fourth is the fractures due to blunt weapon. Then injury caused by sharp weapon, incise wound and stab wound. Injury caused by the firearm, smooth bore weapon, shotgun injury, rifle weapon include low and high velocity. Injury caused by the firearm are mainly the entry wound and exit wound. There when the bull strike the body, there is the injury on the body is called entry wound. Where the bull exit from the body in the portion of the body is called exit wound. Classification of injury on the basis of weapon used. Like the thermal injury caused by heat and cold. Corrosive injury. In corrosive injury by acid like sulfuric acid, nitric acid, and alkalis. Then the electricity, low voltage electricity, high voltage electricity, radiation, natural and artificial. Thermal injury produced due to cold. Injury produced due to cold, local hypothermia. There is a decrease in body temperature called hypothermia. Frostbite the dry cold. When the frostbite occurs in the dry cold. Trench is a type of cold injury occurs in wet cold. Immersion foot and general hypothermia. General hypothermia is decrease in body temperature. Produced due to heat. Injury produced due to heat are burn and scald. Produced by general application of the heat. General application of heat, there is heat stroke, heat aggression and heat cramps. On the basis of the mechanics of the wound produced. On the basis injury caused due to the stationary object, injury caused due to moving object. On the basis of the manner of infliction, suicidal, homicidal and accidental. Or depending on the time of infliction, injury of antemortem injury are injury occurs which before the death. Post mortem injuries are injury which occurs after the death. Depending on the type of energy, mechanical injury, chemical, electric injury, thermal injury, radiation injury. First, we discuss the abrasions. Injury involving only superficial layer of the skin, epidermis, mucous membrane due to impact against some hard, blunt, and rough object weapon. Bleed very slightly and heal rapidly. Abrasion are the minor injuries on the body. Type of abrasion: technical abrasion, friction predominant, like scratches on the mark on the body. Pressure abrasion. pressure, compression predominant, pressure abrasion and pattern abrasion. Two type of abrasion, technetial abrasion and pressure abrasions. These are example of linear abrasion, scratches over the neck. Open the slide number. Next. Next. This is the linear abrasion. Next, this is the scratches over the neck. Graze abrasion. Press abrasion by rough, hard object come into contact with the skin in a sliding or scraping manner. When the body is dragged over a rough surface, so multiple linear furrows. These are the graze abrasions. This is the photos of the graze abrasion on the body. These abrasion occurs in the road traffic accidents. This is also a graze abrasion. This is also a graze abrasion. Pressure abrasion. By crushing of epithelium due to the pressure and friction, may be associated contusion, contused abrasion. Type impact abrasion, second contact abrasion, patterned abrasion and non-patterned abrasion. Impact abrasion, vertically impact force epidermis is crushed. When vertical force is applied on the body, then the epidermis is crushed. The imprint of the object is stamped. Example are radiator, wheel impression on the skin of the victim of RTA, beating by a chain. This is the beating by a chain. Then the contact abrasion, impact force. In this impact force of percent, merely sustained pressure, it reflects pattern of the object, ligation mark of the hanging and strangulation. This is the pressure abrasion. This is the ligation mark of the neck in hanging. Pressure abrasion has some pattern of agent caused it. Pressure of the object is vertical with negligible friction. Rough for ligature, tire mark is run or accident, finger marks in throttling. This is the example of pressure abrasion. This is the pattern abrasion. This is the pattern abrasion on the face by the slippers. This is the pattern abrasion. Non-pattern abrasion. As friction force increase, the abrasion fail to exhibit the weapon pattern. This is the contour abrasion. This is the second. Next slide. This is the contour abrasion. This is the nappy abrasion or diaper rash. Next slide. This is the nappy abrasion or diaper rash. Next slide. Next injury is the contusion. Infiltration of the, next slide. Definition. Infiltration of the blood in the extravascular tissue following the rupture of the blood vessel, usually capillary, as a result of application of blunt force. Usually situated in subcutaneous tissue, may be in various internal viscera. This is the blunt force applied on the body. This leads to the rupture of blood vessel. This is the collection of the blood below the skin. This is the next slide. This is the contusion. There is no rupture of the superficial skin in this superficial layer of the skin in this. There is a collection of blood below the skin. This is contusion. This is a black eye or raccoon eye. This is the punch apply on the first. Due to this, there is a collection of blood near the periauricular area. This is called black eye. Next slide. This is the contusion on the thigh, bluish coloration of skin. This is the pattern signs. This is the collection of the blood under the ears. This is cramp eye abrasion, bite mark. This is the bite marks. Next slide, please. This is the bite mark. Is a pattern abrasion. These are the bite mark on the body. This is the old bite mark. Next, this is bite mark on the breast. Then the artificial growth. By applying the juice of the irritant plant like calotropes, marking nut, chitra, large chitra. These are the side accessible area is self-inflicted. Artificial growths are by the person for self-inflicted injury. Some patient do injury by self or with friendly hand coming in emergency or hospital for the medical legal report. These are the some plants which are those artificial injuries. Next injury is laceration. Laceration is the rupture or tear or split in the skin, mucous membrane, muscle, or any internal organ or underlying tissue as a result of the application of blunt force. There is a split in the skin. There is a laceration, some like road traffic accident due to blunt force and blunt object. There is some injury occurs in the most commonly injury occurs in due to blunt object is laceration. Besides blow from the blunt object, laceration are also caused by fall on the hard surface, machinery, traffic accident, hemorrhage, laceration. Tear type of laceration: tear, split, scratch, avulsion, brushing, cut laceration, pattern laceration, post mortem laceration. This is the blunt force apply on the skin. There is a tear of the skin. Tear of the skin leading to the lacerated wound. This is the lacerated wound of next slide. Lacerated wound of the skull. Then the evulsion. Evulsion is also degloving or destocking of the skin. Skin is outstretched. In run or by motor vehicle, skin and wheel move together and skin comes off. Skin is separated from underlying tissue and hangs loosely. This is the avulsion. In the medical legal, after the observing the injury, we have to mention the age of the time of the injury. These are the points regarding the age of the lacerated wound. In unsutured inflamed skin, in lacerated wound, inflamed skin aging in 12 to 24 hours. Appearance of the infection in 36 to 48 hours. Sutured lacerated wound, inflamed edges 12 to 24 hours. Edges can be easily separated 1 to 3 days. Firm union. There is a firm union of the lacerated wound 3 to 5 days. Red linear tender scar into 7 to 10 days. There is an appearance of the scar in 10 to 7 to 10 days. Pale, firm, non-tender scar. More than 4 weeks. After 1 month, there is a pale or non-tender scar. Then the inside wound, a clean. This is the single cell inside wound. Next photograph. Next. Spindle shape. Type of homicidal injuries. Penetrating wound, perforating wound, incised stab wound, lacerative stab wound, concealed puncture wound. This is the penetrating wounds. Defense wound found on the upper limb of the victim or may on legs produced during the warding of an attack or grabbing weapon. Superficial injury on the other part of body may indicate struggle. It may be fabricated to sustain a charge of homicidal assault on accessible area, may not be serious. This is the defense wound produced on the hands. Shape of the wound and weapon. They are the common shape produced by the weapon when the injury is inflicted on the body. The wedge-shaped wound are by single edge knife, wedge-shaped and deep X. Teardrop-shaped wound produced by single edge knife. Spindle-shaped wound are produced by double edge knife. Crusade-shaped wound are produced by spear-pointed weapon. Circular shaped wound are produced by arrow. Incised puncture wound. Come to the back slide. Wedge-shaped wound are produced by single edge knife. Wedge-shaped and deep wound are produced by X. Teardrop-shaped wound are produced by single edge knife. Spindle-shaped produced by double edge knife. Crusade-shaped wound are produced by spear-pointed weapon. Circular shaped wound are produced by arrow. Inside puncture wound and inside wound are produced by sickle. Slit-like stab wound with scare and produced by screwdriver. Board-shaped rubber tapper knife. Choke wound inside wound by chopper and sword. Stab wound or depending on the number of holes. These are the weapons and this is the shape of the next slide. Next slide. Next slide. Next. These are the common weapons and these are the shape of the shape of the wounds on the body. Next, come on the fracture of the bone. Next slide. Next slide. Fracture of the bone. Fracture is the break in the continuity of bone. It's called fracture. Type of fracture. Simple fracture, comminuted, transverse, oblique, green stick, hairline, avulsion. Depending on the type of wound. Closed fracture bone, no contact outside of the hair. Open fracture bone, heavy contact outside of the hair. Timing of the wound. We can calculate the timing of the wound by neck eye appearance of the wound, histological examination of the wound, histochemical timing of the wound, biochemical timing of the wound. For the aging of the abrasions. Next slide. Abrasion. In fresh abrasion, the abrasion is bright red. When we see in the emergency, fresh bright red, then after 12 to 24 hours, color of the abrasion is reddish scale. Then 2 to 3 days, reddish brown scale. After 4 to 7 days, brownish blackish scab. After 7 days, scab dries, shrink and fall off from the periphery. These are the color coding of the abrasion regarding the time of the abrasion. Next, the contusion. Fresh contusion is red, few hours to 3 days color of the contusion changed to blue. After 4 days, blues black to brown. This is due to hemocytrin. Product of the blood is hemocytrin. After 5 to 6 days, color of the contusion changed to greenish. After 7 to 12, during 7 to 12 days, color of the contusion is yellow. After 2 weeks, color of the contusion is normal skin. Age of the lacerated wound. We have already discussed the age of the lacerated wound. Age of the incised wound. Fresh incised wound, like incised wound by the knife and other sharp edge weapon. Fresh, there is a hematoma formation after 12 hours as red and swollen. After 24 hours, scab dried clot covering the entire area. After this rough estimate, we can based on the sign of the healing. Laceration. It becomes difficult to estimate exactly the time since injury based on the size and contamination. Age of the fracture from the healing of fracture. Healing of the bone. First is the hematoma. 12 to 24 hours. Organization of the hematoma. In 10 days. Callus visible on X-ray. In fracture, callus visible on X-ray after 3 weeks. Callus converted into hard bone. It's seen in X-ray only. After 2 months. Complete healing by remodeling after 3 months. Age of the tooth extraction. When sometimes the patient coming to the emergency regarding tooth is extracted by the blow of some blunt object by some person, we can calculate the age of the extraction of tooth by the color coding. Bleeding as the freshly tooth is extracted, bleeding stop as is sharp and figures in 1 to 2 days. Clot obliteration by the fibrous tissue in 14 days. Socket partially filled with new bone in 3 weeks. Socket completely filled with new bone in 1 year. Point number 3rd and 4th seen only in X-ray. We see the filling of the formation of the bone. Formation of the bony tissue in the socket of the tooth. These are the difference between antemortem injury and post-mortem injury. In the antemortem injuries, the injuries which occurs before death, a post-mortem injury which occur after death. Bleed freely, bleeding is slightly from cut vein, extensive infiltration of deeper tissue, less infiltration of the deeper tissue. In antemortem wound, edges are gapping, edges do not gap. Thinly coagulated blood found in the and about the wounds. Little blood or no coagulated blood will be found in and about the wounds. Arterial spreading mark may be found in postmortem wound absent. Vital reaction is present. Vital reaction is absent in postmortem wound. Then come to the nature of the injury. Next slide. Next. Nature of the injury. Simple injury. Simple injury is the one which is neither extensive nor serious and which heal rapidly. In simple injury include abrasion, laceration, contusion. All these are the simple injuries. Then the grievous injury. Grievous injury under section 322 IPC. First point is emasculation. Second is permanent privation site of either eye. Third is permanent privation of the limb of either ear. Fourth is privation of any member or joint. Fifth is destruction or permanent impairment of power of any member or joint. Sixth is the permanent disfigurement of the head and face. Seventh, fracture or dislocation of the bone and tooth. Eighth, any hurt which endanger life or which cause the victim to be in a severe bodily pain or unable to follow the ordinary pursuit for the period of 20 days. The danger to life. police always sometimes come for the nature of the injury. Police and victim always want that the injury inflicted on his body is danger to life. The police always come for the opinion regarding nature of the injury. They want the injury to danger to life. There are some regarding that danger to life injury, and injury which put in life into immediate danger of death would be an injury which can be danger to life. Patient cannot survive without medical and surgical treatment. When a doctor describes an injury as a danger to life, he means an injury which endangers life in the term of clause 8 of section 322 of IPC. It describes the injury danger to life only for the purpose of said clause. There is the only clause number 8 in the section 322 of IPC. Our Honorable Supreme Court conveyed the message that danger injury, danger to life injury, and injury endangering life are synonyms. All the words are different, but the injuries are the same. Thanks. Thanks, everyone.
बहुत बहुत धन्यवाद डॉक्टर राजेंद्र जी, आपने विषय बड़ी सरलता से स्लाइड्स दिया। मैं आशा करता हूँ सभी अधिवक्तागण को इससे लाभ मिलेगा। अब मैं आग्रह करूंगा डॉक्टर गुरमंजित
on the dais. Respected dignitaries on the dais and after that, since morning you are listening to my two colleagues, Dr. Munish and Dr. Rajender Saini, on the topics which are on the living subjects as you must have seen. In the courts, they are coming for evidence, they are coming for attending the cases as victim party or the accused parties, and you must be appearing in the court along with these people. But my topic is little bit different, which deals with the dead, and dead bodies, they always come to the doctors for autopsy. Anybody wants the autopsy to be done on the subject of his or her relations? The answer will be no. Nobody wants a such type of autopsy or a procedure on a dead body which is close to their heart, or with him they were living just a day earlier. Just 1 minute, please. So what is autopsy or post-mortem examination, as the topic is assigned to me for today? This is also called necropsy or post-mortem examination. Autopsia cadaverem or abduction is the dissection and examination of the dead body, its organs and structures, derived from the Greek term autopsia, that means to see with one's own eye. The term autopsy is derived from two Greek terms, Autos means self, and office means offices or view. What does literally it means to see with one's own eyes or to see for oneself. In medical science, autopsy or necropsy means medical examination of the dead body. Medical examination of the dead body, it has been used in reference to determining the cause of death earlier times since 17th century onward. Now we are in the 21st century. Post-mortem examination means by two-term autopsy and post-mortem examination are frequently used, as you must be dealing with such cases that post-mortem autopsy. Somebody is telling that I have come for autopsy, and somebody is telling post-mortem examination. Right? However, post-mortem examination broader term. It means all examinations conducted or performed after death of the person. And autopsy is inclusive of the examination of the dead body at the scene of crime or at the place of death. And when we say at the place of death or at the scene of death, the doctors are not going at the scene of crime generally. But in India, we are not visiting to the scene of crime as far as doctors working in the hospitals are concerned. But yes, in some foreign countries, doctors, they do visit the scene of crime for the scene of crime examination, where the system of inquest proceedings is by the doctors, that is medical examiner system, as we see in the United States of America. Right? Their doctors are working as medical examiners, and they're doing the inquest proceeding as we are having here correspondingly by police and magistrates in that custodial. Right? So doctors are not going to the scene of crime. Then who is doing the examination at the scene of crime or the place of death? It's the police when informed in unnatural cases. Unnatural cases, what they do, they go there, they record the statements of the victims, attendants, they gather some people of the respectable persons of the society or the village sarpanch or lambardar, then they get the information regarding the exact what happened at the scene of crime. Then they examine the dead body, clothing of the person, and what is the probable cause or alleged cause as alleged by the victim's relatives. In our country, the form is invariably done by the police in assistance with the mobile FSL team, that is scene of crime, where the autopsy is conducted by doctor, the nearest civil surgeon, or other qualified medical men appointed in this regard by the state governments. So, who are the persons who are doing this autopsy work in the civil hospitals? As we are seeing, medical officers appointed by the state governments are doing in the district hospitals, in medical colleges or institutes levels like AIIMS, New Delhi, and other AIIMS of the country, and PGA. So these are the stations where autopsy is being carried out. As well as private autopsy is concerned, nowhere in the country is allowed as far as private autopsy is concerned. It is done on the request of the police or on the orders of the honorable magistrate of the area. So what are the types of autopsy? You must have been by now only hearing this type of autopsy which is got done by the police, or when you visit autopsy room for getting autopsy done. But no, there are different types of autopsies like clinical or pathological and hospital autopsies. What is this clinical, pathological and hospital autopsy? When we want to know, or relatives of the deceased want to know why our person has died. But it is not a medical legal case. It is not a case requiring legal proceedings or court case in the court for getting some person punished. But yes, they want to know why our person has died, whether he has died as a result of heart attack or whether he has died due to some other reason. What could be the reason? Then they go to the hospital in charge that we want to know the exact cause of the death of the person, that is clinical, pathological or hospital autopsy. Where, how we can conduct this autopsy? A doctor can conduct this type of autopsy on the consent given by the relatives of the deceased only, and on the request of the relatives of the deceased for conducting such type of autopsy, that is consent is must. Then second is medico-legal autopsy or forensic autopsy, which we are dealing with in the medical colleges, departments of forensic medicine and toxicology, and civil hospitals, AIIMS like institutions and PGI, etc. Then third autopsy is anatomical or academic autopsy. What is this anatomical or academic autopsy? This is autopsy which is carried out when a doctor or an MBBS student enters the medical colleges and they want to know what is the structure of the various organs of the body, what are the structures of the bones, what are the muscles, what are the blood supply of the muscles, how the organs are working in the body, liver, spleen, kidneys are functioning, brain is functioning, and such type of organs, to know the anatomy of their structures, physiology of the functions, structures, and pathology of the structures. We want to study the dead body, that is in the anatomy departments when the MBBS graduates they enter the medical course. Right? That is academic or anatomical autopsy. Now, what are the objectives of clinical or pathological hospital autopsy? As we have discussed, to determine the disease causing death, to determine, clarify, or confirm clinical diagnosis that remain unknown or unclear prior to the patient's death. Then second is to evaluate the efficacy of treatment given. Third is to educate the medical students in certain organs and tissues for transplantation purpose. For transplantation purpose, as you must have gone through the various media reports that such hospitals are transplanting the organs like liver, spleen, kidneys, then cataract surgery, that is cornea transplant and heart transplant, lung transplant, etc. So from the cadaver, yes, we can remove the organs from the cadaver if the person is on the death table or in the hospital, and the organs can be removed and sent for organ transplantation with the consent of the party. Then medico-legal autopsy or forensic autopsy, special type of scientific examination performed on the body of the deceased person, carried out under laws of the state only on the requisition of the legal authorities responsible for the investigation of sudden, suspicious, violent, and unnatural deaths. So these are three things should be there. One is sudden, one should be suspicious, one should be violent or unnatural death. No unnatural deaths, although sometimes we deal with the unnatural, natural types of deaths also when police brings such type of cases under section 174 CRPC for getting the autopsy done. Just on the request of the party, for example, a person is working in the armed forces, then the police comes with the request that Dr. we want the autopsy to be done in section 174. Since the armed forces, they require the post mortem report in such cases. And similarly, the paramilitary forces, people working in the paramilitary forces. The legal authority is usually police officer, not below the rank of the sub-inspector for getting the autopsy done, usually. But we have seen where even the head constable, senior head constable rank, where people are acting as an investigating officer in such cases of 174 CRPC. So this type of deviation are seen while doing autopsy work in the field. Then what is the objectives of medico-legal autopsy which we are concerned about today? To determine the cause of death. Number one, to determine the manner of death, whether it is accidental, homicidal, or suicidal. To estimate the time since death, how much time has elapsed for the death to have occurred, whether 2 days, 3 days prior to this time death has occurred of the person, or after getting injury, how much time he survived. So this is the time since death. Then sometimes, not always, to establish identity of the deceased when not known or unidentified dead body. Then when the police wants help of the doctor to identify the dead body, right? Then to how the injuries have occurred. Then to collect evidences to identify the object causing death and to identify the criminal. The next objective is to retain relevant organs or viscera and tissues as an evidence to be produced later on in the court in the form of the reports of the officers, reports of the pathologist, reports of the serologist to Government of India, and sometimes even bullets or fragments of some sharpeners of the bomb explosion, etc. They are to be required to be preserved and sent for FSL examination for the reporting to be done by the ballistic experts people to determine the question of viability and life worth in case of small babies or infants dying as a result of some unnatural death by the accused party. Then these are performed, anatomical autopsies are performed or academic autopsies are performed by the students of anatomy, as we have seen or discussed just now, to learn the normal structure of the human body, usually done on the unclaimed dead bodies who are handed over to the anatomy departments by the principal or other such governmental authorities. Or sometimes what happens, the people they want to donate the dead body for medical purposes. People, they come to the hospital, they come to the medical colleges with the request that doctor, we want to donate our dead body for the purpose of medical students so that they can learn the various parts of the body. So they willingly come to the department. Recently, we have received 2 dead bodies in our institute on the request of the relatives of the deceased that they want to donate the dead body for anatomy department. So these things happen in the society when they want that our relatives should help the society at large for the purpose of medical education. Then this is a flow chart showing the autopsy, clinical autopsy, complete and partial forensic autopsy, and it should always be complete. But nowadays, since we are advancing every day in the field of science, now digital autopsy, you must have heard, virtual autopsy word term has come, where the people are doing just MRI scan or CT scan and they are giving the cause of death. As far as legal status is concerned, you all know better than me, and since the law of the land doesn't allow such type of autopsy to be carried out, as previously we were doing a forensic autopsy by opening all the body cavities of the person's body, right from skull, thorax, and abdomen, and this giving the cause of death. But as far as legal status of such type of autopsy, that is virtual autopsy or digital autopsy is concerned, it is still to be decided by the Honorable Parliament of the country or the Supreme Court, right? Then what are the rules for medical autopsy? Organizers, please let me know the time. Up to how much time I will be? What are the rules for medical legal autopsy? Performed only when there is official order authorizing autopsy from the police, magistrate, or the coroner. As we were having a coroner system of inquest in the presidency towns of Bombay and Calcutta previously, but this thing has been abolished since 1990. And now we are having only 2 types of inquest, that is police and magistrate inquest. The body must be identified, the policemen and relatives, friends, and their names must be recorded in the report. Unidentified bodies, marks of identification, photographs, fingerprints, and all other means which may be helpful must be noted in case of unidentified dead body in the post-mortem report itself. Right now, we are little bit carefree regarding identification of the subjects concerned, since there is a provision of Aadhaar card, as you must be always, all of you must be having, even today with you, the copies of the Aadhaar card for identification purpose. So there is a little bit difficulty in coming to the identification part of the dead bodies which are coming for autopsy, as we are having database of the Aadhaar card all over the country of each and every subject. So the police goes for Aadhaar card and see the person who is the unidentified person. But in case of fragment remains, it should be conducted only in the mortuary which is authorized by the state government, that is medico-legal autopsy, not at the scene of crime, except in very, very exceptional circumstances. Exceptional circumstances like, for example, a tragedy occurs like a railway accident on the scene of crime. You may have to establish temporary autopsy center on the railway line itself, or in the railway train itself for conducting autopsies. So that is an exceptional circumstances. Similarly, in case of any big flood, tsunami, or aircraft accident, sometimes the autopsy can be performed at the scene of crime itself. But generally speaking, they should be conducted in the mortuary and never in a private room. So private room should not be used for conducting medico-legal autopsy. Performed on all days of the week, inclusive of the public holidays, because there should be no delay in the process of crime investigation. This thing, as far as timing of the autopsy is concerned, we have faced so many problems during the last 30 years of my career in forensic medicine, that whenever the time comes about 5 p.m., the people comes with the dead body and they pressurize the doctors that kindly conduct this autopsy right now. But as far as law of the land says that it should be done till 5 p.m. Then what happens, since the people are working in the state government doctors are doing, then what happens, civil surgeon will telephone you, then minister will phone you, the doctor, you have to conduct this autopsy right now. So these are the elements with the doctors working in the autopsy room, that they are being pressurized to conduct autopsy even after 5 p.m. Sometimes on taking on humanitarian grounds, we do autopsies after 5 p.m. but till sunset. This should be legally allowed. This should be legally conducted, that no autopsy should be performed after sunset. Right? Then inquest report, case sheet, summary, accident register must be read carefully by the doctor before conducting autopsy. Autopsy should be performed as soon as possible after receiving requisition. Examination as far as possible should be conducted in daylight, because in artificial light, color changes are difficult to appreciate in the tube light or in the color light during nighttime. Otherwise too, since we are living in a country where the religious customs are very much attached with the dead body, they don't want their dead body to be touched by anybody during the night. As you must be knowing, everybody is aware of this fact that people are not cremating the dead body after sunset. Only in exceptional circumstances, you must have heard in the electronic media that somebody has cremated the dead body during night. Recently, there was news in the media also in the state of Dereliction state, where the dead body was cremated by the police during nighttime, and a big hue and cry was created next day that why the dead body was cremated in the nighttime without the knowledge of the relatives or the deceased. If the dead body is received late in the evening, a preliminary examination is done to external appearances, body temperature, superficial injuries, extent of cadaver lividity, and rigor mortis only. The actual post-mortem examination can be performed on the next day. So this is the standard protocol which should be followed for conducting autopsy. No unauthorized person should be present at the time of autopsy. The IO may be present for the purpose of seeing the injuries, not the total autopsy. But there is some discrepancy between the inquest report and the injuries present on the dead body. And the doctor finds that there are injuries which are present on the dead body, they are not mentioned in the inquest report of the IO, then they can call the IO inside the autopsy room and show to him that such and such injuries are present, such as a ligature mark or any other mark is present on the dead body, and this should be recorded in the inquest report. Otherwise, it is our duty as an respectable citizen of the country that no crime should go scot-free. In each and every case, examination must be thorough, complete, all cavities must be opened because evidence of factors contributing to the cause of death may be found in more than one organ. Even if the body is mutilated, fragmented, or decomposed, autopsy should be performed as certain evidence may still be discovered. Then, next is nothing should be erased and all alterations must be initiated in the report. This thing has been covered in the states of Punjab, Haryana, UT, Chandigarh, since we are now preparing reports, as my junior colleague has just now told you that we are using online reporting system on the Medlipa portal in which the reports are prepared by the doctors and the computer errors are rectified right while preparing the reports, and they can be even edited while preparing the report. And this type of erasing and alteration are things of the past now. After completion of the autopsy, the dead body is always handed over to the policeman, not straightaway to the relatives of the deceased, since we are conducting autopsy on the request of police or on the orders of the magistrate in case of custodial deaths. Post-mortem report should not be issued to the party straightaway after perquisition, but yes, they can get the copy of the post-mortem report after submitting the required fee of the state government, whatever is applicable there in the state, and get the copy of the post-mortem report as far as victim party is concerned. As far as legal status of this is concerned, no report of the post-mortem report should be given to the accused party till the filing of the challan in the court of law or NOC has been issued by the IO for giving a post-mortem report. If any discrepancy in the injury is noted in the inquest report, those found on the dead body, the IO should be shown the injuries so that the necessary corrections may be made in the inquest report there and then. Otherwise, you can write on your own that such and such type of injuries are present which are not mentioned by the IO in the inquest report. And you can definitely write in the report that IO was not agreeing to my suggestion of writing the injuries in the post-mortem inquest report. What is the preliminary autopsy data? Gather as much as information as possible about the disease and events that led to death, may include medical records, consultation with the doctor, statement of family members, investigation of the area where the person died, circumstances surrounding the death, consultation with the police. Then these are the parts of the post-mortem report. One is preamble, body of the report, and post-amble, what is introductory data of the person, that is identification parts, then persons who have identified, persons who have brought the dead body, what was the time of the entry in the dead body in the mortuary, and time of receiving the police papers, and starting time of the post-mortem examination. These are all the preliminary findings which are required to be noted down in the post-mortem report, apart from body of the report, which consists of all the examinations of the body cavities, apart from injuries and any other thing which is found on the dead body, along with the examination of the clothing. Then post-amble, that is opinion or inference based on the findings and observations of the doctor. Then the time since death and manner of death, in case the police wants to get this information from him. Then this is the detailed preamble data which should be filled by the doctors while preparing the autopsy report. Then body of the report consists of complete description and findings on external and internal examination of dead body. Should contain complete description of injuries, number, size, type, dimensions, shape, situation, exact location, and distance from at least two anatomical landmarks should be mentioned in the report of the postmortem. All important negative findings, they should also be recorded in the report. In case somebody is finding some negative report, we should be helpful to the law in the court of law. Then that should be recorded in the postmortem report. Post-amble, includes opinion regarding cause, mode, manner of death, and time since death based on the findings observed during autopsy. Opinion should be honest, objective, and scientific opinion of the doctor. This should not be a haphazard report, or it should not be like that IO says that doctor, what is the report? I am not understanding the report. The advocates in the court of law, they are saying, what is the report of the doctor? We are not understanding the report. The way the doctor has led us to, while contesting the court case in the court of law. Then external examination, general condition of the body as regards height, weight, build, nutritional status, condition of the skin and hair, rigor mortis, post-mortem staining and decomposition. Then clothing examination should be listed, examined with regard to nature, condition, tears, cuts, holes, loss of buttons, disarrangement. Each item is removed from the body, and remove the clothing carefully without tearing them. If they can't be removed intact, they should be cut along the seams, not in the haphazard way. Stains like blood, seminal stains, grease stains, etc., they should be described in detail in the post-mortem report itself. In all cases, sexual assault, vaginal and anal swabs are taken along with blood samples and any other material which should be taken by the doctor while conducting autopsy for the purpose of DNA, for the purpose of blood grouping, and for the purpose of detection of spermatozoa in case it's a case of sexual assault. And as far as latest definition of rape is concerned, even the anal intercourse also covers the rape part. So we should be very, very careful while conducting autopsy. Note the presence of stains on the skin from blood, mud, vomit, and feces, etc. Note the presence of signs of any disease, and face should be examined by the frothy fluid. For the frothy fluid at the mouth and nostrils, cyanosis, and petechial hemorrhages, pallor, etc. The eyes should be examined for the condition of eyelids, conjunctiva, color of the sclera, pupils, contact lenses, petechial hemorrhages, periorbital tissue for expulsion of the blood for any type of injury. Then neck should be examined for bruises, fingernails, abrasions, ligature mark, any other abnormalities as we generally see in cases of violent asphyxial deaths like hanging, strangulation, throttling, etc., where the nail marks or the thumb marks are present on the front of the neck, then ligature marks are present in case of hanging and strangulation cases. Then thyroid is a gland which is present on the front of the neck. Their size, motility should be noted. Lymph nodes, cervical, axillary, and inguinal lymph nodes should be noted and examined. Thorax, symmetry, general outline. Then breast size, masses, etc. They should be recorded. In the abdomen, presence and absence of distension or retraction, striatum in case of pregnancy or delivery-related findings. Then back, bad sores, spinal deformities, etc. External genitalia of the person, general development, edema, local infection, position of the testes, they should be examined. Then natural orifices like mouth, nostrils, ear, vagina, for any type of secretions, for any type of injuries, foreign matter, blood, etc., they should be examined. Hands should be examined for injuries, defense wounds, electric mark, if planned to open the hand completely, fracture tendon, cut at wrist. Look at for the needle marks present in the arms, buttocks, etc. in cases of concealed puncture wounds. Concealed puncture wounds are the methods of causing death of the small babies like less than 1 year of age, where the assailants, they want that the cause of death may not be detected by the doctors while conducting the autopsy. They go in for needle pricks in the skull of the individual for causing death of the small baby. Then external injuries like abrasions, bruises, lacerations, burn scars should be examined systematically with full details to include exact site, length, breadth, direction, position, margins, base, and extent of the burn. They determine whether they are caused before or after death and the time of infliction. Now, coming to what is the procedure being followed in the autopsy room, primary skin incisions are given. One is I-shaped incision, one is Y-shaped incision, and one is modified Y-shaped incision, which are used for conducting autopsy. I-shaped incision is the most commonly used incision world over, since this is the most simple incision and easy to conduct. That is opening of the dead body right from the middle of the both the clavicles, that is sternal notch, up to the pubic symphysis, without cutting the umbilicus part. So this incision opens the dead body into two parts, that is from left and right side, both sides. Reflections of the skin are muscles are cut and body is seen. Organs are examined by opening with I-shaped incision. Then Y-shaped incision begins at a point close to the acromion process, that is on the both sides of the shoulders of the person, extends down below the breast up to the xiphoid process and make a similar incision of the opposite side, making a straight line up to the pubic symphysis, that is in the region of the external dead area. Then Y-shaped incision is desirable in those cases, especially females, where it's customary to keep a dressed body for some time after death of the person. Then modified Y-shaped incision is also there, where we want to examine the neck structures for the purpose of violent asphyxial deaths like hanging, strangulation, where the ligature mark and other conditions like higher bone and other thyroid complex is to be examined and seen for the purpose of fracture of the higher bone. A use when a detailed study of neck organs is required, like hanging and strangulation. Then what are the methods of dissection of the organs? There are 4 methods of dissection of the organs of the body, named as Barshaw's method, Rokitansky's method, Zatle's method, and Cohen's method. These are the persons who have discovered these methods for the dissection of the dead body. And by flow chart, Barshaw's method is a method in which individual body organs are removed one by one from the dead body. That is organ dissection. Rokitansky's method is when organs are examined in the body itself after opening the chest and abdomen, and they remain inside the body of the person without cutting. Just for dissecting, we examine the dead body organs and keep the organs inside the body as such. Then Lattice method and mass dissection and organ separation is done one by one, system by system, that is chest and abdomen. Then Cohen's dissection is separate block dissection, that is for organ separation. So what is the main purpose of these 4 methods is that body should be remain intact, and there should be no disfigurement of the body after examination by the doctor. So such type of methods are used by the doctors while conducting autopsy in the autopsy room. So this is the various persons who have discovered. Adolf Virchow was father of pathology and German pathologist in the year 1822. Organs were removed separately one by one and studied individually. Cranial cavity, thoracic cavity, and cervical region, abdominal cavity are examined. This is one method which is most widely used, quick and suitable for the beginners who are conducting autopsy for the first time. The disadvantages of this is causes loss of continuity of the organ, difficult to evaluate interrelationship between the various organs of the dead body, and little bit disfiguration of the dead body also takes place while conducting autopsy, since the shape of the body contour changes after autopsy. Then Rokitansky's method, advocated by Karl Rokitansky, German pathologist, in situ dissection in part combined with envelope removal. Advantages are in infected bodies of HIV, hepatitis, and recently COVID-19 cases of the body where infected bodies are there. The doctors can be saved of the infections which are there in the dead body by conducting such type of dissection of the dead body in situ. That is within the dead body of the person. Considered good in children, disadvantage is difficult to perform. It is difficult to perform such type of method. Then Lattice method, advocated by Mars Lattice, French pathologist, and Mass method. All organs are moved and masked and dissected as organ block. Advantages of this method is that organ interrelationships are preserved. body can be handed over quickly at disadvantage the organs difficult to remove. Gohan's method and block dissection, devised by Australian pathologist Anton Gohan. Excellent preservation, handling of the organs is easier. Disadvantages, again, interrelationship is difficult to study if the disease is extending to all blocks. Then cranial cavity. How this is opened. Typical scalp incision involves a cut that is made from one mastoid to just behind the one ear to the other side. From the top of the head, behind the opposite ear, intermastoidal incision is given like this, as you must be seeing in the photograph. Scalp is reflected forwards, backwards, then skull is cut by instrument by cutting the temporal muscles on either side, making a V-shaped saw line. Then saw line should pass through the center of the forehead, base of the mastoid process in backward and upward direction to a point where a little above the occipital protuberance is done. So this way, the skull cap is removed, and then comes the membranes of the brain. By cutting the membranes, we will reach the brain itself, brain like this, which is lying in the cranium cavity. How to remove the brain? We just put our 4 fingers on the frontal side of the brain and push the brain outside and cut the base of the brain and remove the brain from the cavity and examine the brain by giving serial incisions longitudinally as well as horizontally for seeing any injury or any hemorrhage inside the cranial cavity. The section of the brain in normal anatomical position, cut it in 2 halves with a long knife with a single incision passing through the corpus callosum, midline of the brain, pons and medulla. Cerebral hemispheres are placed down on a board and serial sections are made in coronal plane, that is horizontal plane, starting from one pole to the other at 1 centimeter distance. Then other method is to make cut through the cerebrum parallel to the cutting board. Dimensions of the wound can be measured by these parallel sections. So this is the circle of Willis, that is blood supply of the brain, which is covering the internal aspect of lower aspect of the brain, where the vessels are present. And in case of brain hemorrhage, which we commonly say that a person has died due to brain hemorrhage, these are the vessels from where the middle cerebral artery must be doing this. In the photograph, middle cerebral artery is the artery which is responsible for the brain hemorrhage, which is occurring in the old people and adult ones. So this is the aneurysms which are present on the vessels of the person, which bleed on their own in case a person is having high blood pressure. Again, because of the ruptures of the varic aneurysms which are present in 40% of the anterior communicating arteries, middle cerebral artery and posterior where the bleeding takes place and person dies as a result of a brain hemorrhage because of the rupture of the varic aneurysms. So this way, in infants, the skull of the small babies are opened by giving incision with a scalpel blade itself. There is no need for cutting of the skull, since the bones are very thin and very delicate. They can be cut even by a scalpel blade. So spinal cord, as far as spinal cord is concerned, not examined routinely unless there is an indication of any disease or injury. Posterior approach is applied, that is by keeping the body in prone position, that is mouth downward, and placing the body on the table and opening the spinal cord from the back of the individual, right from the occipital region, that is nape of neck, up to the sacral region. We give an incision and open the dead body for examining the spinal cord and vertebra. So laminar thought, according to close to the transverse process, and this dura, spinal cord along with the dura is picked up in successive nerve roots and attachments of the dura being cut with scissors from below upwards. This is examined. So what are the indications for opening of the spinal cord in case of firearm injuries when the bullet is stuck in the vertebra of the body of the lumbar spine or the thoracic spine? Then this is an indication. Then in case of spinal poison, like strychnine poisoning, strychnine poisoning and tetanus where the opening of the spinal cord is required. Then in case of any injury by sharp-edged weapon or any injury over the cervical spine, in case of asphyxial death or violent asphyxial death, where sometimes we need to examine the cervical vertebra or any fractures for opening the spinal cord. Since now we are in 21st century, when we are having all types of investigations with us, like CT scan, MRI scan, X-rays. X-rays with us in the hospital. In case such type of situation arises, the doctor can get autopsy, before autopsy, X-rays of the individual done to see where exactly the bullet is placed, and that part of the spinal cord should be opened instead of opening the complete spinal cord of the person, and vertebra, all vertebra should not be cut. Then cut the spinal cord at the foramen magnum, separate the cord along with entire length, open the dura by forceps and incision to examine the cord. So this is a diagrammatic photographic representation for opening the anterior approach. This is the posterior approach. Thoracic cavity, bone saw is used to cut the front of the chest plate of the chest wall, and ribs are cut, and after cutting the ribs and sternum, the chest cavity is opened, and you can view the lungs as we see in this photograph. Pleura and lungs are lying in the chest cavity, they can be examined. Then removal of the heart, pulled forward, upward, removed by cutting the inferior vena cava, pulmonary vein, pulmonary artery, aorta, and superior vena cava are removed for removal of the heart. Then dissection method of the heart is according to inflow-outflow method of the blood supply of the heart. The dissection is made for seeing any damages to the valves of the heart, any vessels of the heart, any walls of the heart, whether they are hypertrophied or enlargement of the heart is there, or increase in weight of the, or any coronary atherosclerotic changes as far as blockage of the coronary arteries are concerned. They can be seen with the naked eye, and accordingly you can give the cause of death. Then this is the inflow-outflow blood supply of the heart, by which we can examine the heart. Left atrium is open with the scissors from the tip of the appendage across the body of the atrium, then left ventricle, then outflow cut travels parallel to the anterior ventricle septum and about 1 centimeter from it. Curve cut is best accomplished with the scalpel care, should be taken not to cut on either side. So scissors can be used to extend the cut across the left aortic cusp. So this is a lungs. When examined, lung blade knife is placed under the hilum on each side of the lung with blunt edge upward and turned down to the around so that sharp edge is upward. With a short sine motion, the hilum is completely cut through, cut across the apex to base with large blade knife held parallel to the bone. So what is the purpose of removing the lungs in case of asphyxial deaths, in case of poisoning by asphyxiants, in case of carbon monoxide poisoning, and in case of poisoning by OPC and other, where you can detect the poison by smell of the coming out from the cavity of the chest, and doctors, they can very easily make out that whether it's a case of OPC poisoning, or it's a case of carbon monoxide poisoning, or it's a case of any other asphyxiant gas. So some idea can be had, although it's not an exact information regarding the poison. No doubt we will have to send the viscera for chemical analysis to come to know the report of the chemical examiner to come to the exact conclusion. Then dissection of the neck, extending into the neck, wooden block is placed under the shoulder. Incision, neck is best dissected by modified Y-shaped incision for coming to the conclusion regarding any fracture of the hip bone, fracture of the thyroid complex, or fracture of any vertebra in case of asphyxial deaths like hanging and strangulation. Then carotid arteries are examined, esophagus, larynx, and trachea are examined. They are examined in the neck section. Abdominal cavity, stomach, double ligature on each side is given for moving the ligature stomach, and it is removed from the abdomen of the person. Then after removing the stomach, it is examined in the tray, and after opening the valve of the stomach, we get to know what are the contents of the stomach, whether the stomach is congested or normal internal aspect of the stomach is there. Then contents are having any smell, what is the condition of the food which is lying in the stomach, whether it is digested or undigested food, and whether it is any there's any blood or any other substance in the stomach of the person that can be examined and told in the report or written in the report itself. Then intestines, about 1 meter of intestine is removed for sending it to the chemical examiner for poisoning purposes. Otherwise, intestine is examined from top to bottom for seeing any type of injury or any other thing which is lying inside the intestine. Then spleen is a small organ on the left side of the person's body, just below the stomach. It is seen for any enlargement, for any hemorrhage or any shrinkage, as we see in case of infected dead bodies. Spleen is markedly enlarged, or hepatosplenomegaly, which is enlargement of the liver, and spleen in case of infected dead bodies. Then it is section like this, that is a vertical section is given and noting its size, consistency, weight, and then capsule and injury or disease is seen. Then kidneys are examined like this. Longitudinal cut is given after removing the kidney and for seeing any stones, any hydronephrosis or any other thing, whether it is a large kidney or smaller kidney, that can be examined. Then liver, similarly, liver is also moved and examined for any lacerations, stabs, or any other thing which is there, whether it is a large or shrunken liver, like in case of chronic alcoholic cirrhosis, where the shrunken nodular liver is there, which is hard in consistency. Then testes inside the peritoneal aspect of the inguinal canal. Free the vas to internal inguinal ring, push the testis up to the scrotum with right hand, pull the vas with left hand. After removal of the testis, hold the testis and epidermis for seeing any type of congestion, especially in squeezing of the testes. One may not come to any conclusion regarding cause of death, since there's a history of this thing, that the person's testes were squeezed at the time of assault by the assailant party, and just police tells that there's no external injury on the body of the deceased and come for autopsy. Then this is the most important finding which can be had by the doctor after dissection of the testes. If there is hemorrhage inside the vas deferens and testes, then definitely this is a cause of squeezing of the testes. Otherwise, normal testes are never having any hemorrhagic spots in the substance of the testes and vas deferens. No doubt, you will have to rule out other aspects of the cause of death for any poisoning and injuries, any other part of the body too. Then female genitalia, vaginal canal should be opened from below upwards, examined for any foreign material marks of injury. Vagina and uterus are slit anteriorly, posteriorly after the fundus. 2 short incisions are made in the fundus from main longitudinal incision towards each corner to expose the endometrium. After opening, examine the mucous membrane and thickening of the wall of the stomach, uterus. Then, if the uterus contains fetus, age of the intrauterine life should be noted. Ovaries and fallopian tubes are freed from the pelvis, uterus, and then moved. Ovaries should be chiefly examined for corpora lutea in case of alleged pregnancy in unmarried and married ladies, where some suspicion of pregnancy is alleged by the police. Then these are the photographs showing the various incisions, that is eye-shaped incision, modified incision, and small infants, and the autopsy room, which we are generally performing. Then this is a comatose patient in the hospital setup, that's ICU. This is a hospital mortuary where we are generally performing the autopsies and bodies which are kept in the autopsy room. Then what are the modes of death? Just 5 to 10 minutes I will be taking. I will be keeping free just now. Please bear with me. Causes of death are asphyxial failure, respiratory failure, syncope is a cardiovascular failure, and coma is a brain death. When we are writing in the report asphyxia as a result of failure of the function of the lungs. When we write syncope, it means it's a failure of the function of the heart. When we write coma as a cause of death, it means it's a brain death, failure of the function of the brain. Then these are the instruments which are used in the toxinome. These are the names: scalpel, chisel, measuring tape, balance scale, glass bottle, chemicals like rectified spirit, formalin, and saturated solution of the common salt is used for preserving the viscera. These are the various external examination marks like cord, ligature mark, finger marks, then manner, application of the knot, etc. We are required to see at the time of examination of the dead body. Then hands for examination of the any injuries, scraping, nail marks. Then genitalia, desk, condition of the body, whether it is stout or emaciated. Then injuries which are seen, generally contusion, abrasion, lacerations, inside wound, punctured wound. As these are the injuries which are generally seen on the dead body, which my colleague has just now described in detail. What are the injuries, how we assess the aging of the various injuries like abrasion, bruise, inside wound, laceration, then fractures of the bone and tooth. Then these are the photographs of the injuries like contusion, abrasion, laceration, inside wound, then punctured. Then this is a avulsion of the skin of the leg along with the fracture of the forehead in the lower picture and cutting of the skull in case examination of a fragmentary remains comes for examination to account. These are the types of weapons which are used by the assailants at the time of attack, like blunt weapons, then hockey sticks, then bamboo sticks, then bricks and stones, then sharp objects like knife and cookery, etc. These are the firearms, then hot liquids, bricks, then sharp pointed weapons like sword and spear and knives, etc. These are the burns which are usually examined at the time of death examination, dead body, first degree, second degree, third degree, cause of burn, fire, fluid, corrosive substances or explosive substances, and percentage of burn is also recorded by the doctors. These are the photographs showing the first degree, second degree, third degree, and charring of the dead body during examination by the concerned doctors. Then internal examinations, general missing organs, they should be recorded in the post-mortem report. Otherwise, there can be legal problem as well as medical legal problems with the doctor also. If he is not writing in the report that kidney was missing at the time of autopsy, then a big problem can be there with the doctor who is conducting autopsy. He can be charged with the allegation by the victim party that the doctor has removed the kidney for purpose of transplantation, or the cornea, which in case you are removing, that should be recorded in the report itself that cornea has been removed with the consent of the police or the results of the disease. Then videography, when custodial death is there suspected and magistrate has requested for videography, then it should be carried out. Videography in any case can be conducted on the request of the police. It is the police who is to arrange for videography procedure and arrangement for the photographer and videography is concerned. Then poisoning cases, tissue samples of stomach, small intestine, large intestine, liver, spleen, kidney, nail scraping, and skin incision, they should be taken. Uterus, vagina, spinal cord, heart, lung, brain, CSF, long bone, blood, vomit, urine, and feces, they are to be preserved in case of poisoning, in the case may be. Then post-mortem forensic toxicology, all suspected drug intoxication cases, all homicidal cases where alleged cause of death is poisoning, all cases of arson, fire deaths, all motor vehicle fatalities, at least their blood samples should be preserved for alcoholic intoxication purposes, since the law of the land says that Motor Vehicle Act says that every autopsy should have a level of intoxication in case the person has consumed alcohol or not. Then deaths due to natural cause, again, you can send the viscera for toxicological examination. So these are the indications for sending. Then examination of mutilated or fragmented remains, circumscribed penis, probable age from skull, teeth, dentures, gums in the jaws, color of hair, ossification of bones, sex from head, trunk, hair, pelvis, femur, prostate, ovary, and uterus. So these are the mutilated bodies or fragments when come for examination. And most common questions by the police which are put in the request are whether the bones belong to human being or not. What is the sex of the individual, whether male or female. Then what is the race of the individual, whether he is a European, whether he is an Asian, whether he is a Negro or any other race. Then what is the cause of death in case the person's mutilated body or fragmented remains are brought by the police. Then last about what could be the time since death, whether 6 months, 7 months, 4 months, 10 days. So these are the queries which are put to the doctor for conducting autopsy and coming to know the reason for it. Then identification as far as mutilated bodies are concerned, from the dentures, from tattoo marks, from the structures present like fingerprints, DNA, and any other deformities like such as we see in the photograph of the person's back. There's a scoliosis and kyphosis type of picture which is present in the photograph, by which you can examine and state that the bones of the person was like this, and he might be having this type of deformity at the time of when she was alive. Then post-mortem report and its value as far as report prepared by the doctor, whether that is having any legal value. Yes, it is a very good piece of evidence, but not a substantive piece of evidence. It is not a substantive piece of evidence. Statement of the medical officer has to be made in the court of law for appearing in the court of law and getting cross-examined by the defense counsel, as you might be doing in the various courts. Then medical officer, yes, he can use it for refreshing his memory by giving evidence, for corroboration and contradiction of medical officer, reserving opinion as to cause of death, pending result of the chemical analysis, and last of all, when everything you have ruled out, you can say that it is a negative autopsy or cause of death cannot be asserted. So one is obscure autopsy, one is negative autopsy, and when we say that it is a negative autopsy, when we have ruled out everything, we have ruled out toxicology part, we have ruled out injury, we have ruled out disease, and meticulous autopsy has been performed without leaving any lacuna in the autopsy, we say that the cause of death in this case cannot be asserted. Since we are also human beings, we are not machines like computer who can tell that what is the cause of death, and we can see what is the cause of death. With this, I finish my talk. Thank you very much for the patient hearing. Any queries right from my colleagues, Dr. Munish, Dr. Rajender, Saini, and myself. Love to answer any query of yours. If you are, yes.
थोड़ा later. अभी वकील साहब सीनियर लॉयर हैं, वो आएंगे बाद में query.
Right, right. Please.
बहुत बहुत धन्यवाद डॉक्टर साहब। इस सभागार में मौजूद सभी अधिवक्तागण को भी धन्यवाद, उन्होंने पेशेंसली आज के कार्यक्रम में डॉक्टर साहब को सुना। अब मैं इनवाइट करूंगा श्री एस.सी. शर्मा जी, जो क्रिमिनल के जाने माने सीनियर एडवोकेट हैं, वो आए और अधिवक्तागणों को और जो यूट्यूब और फेसबुक पर हमारे लाइव देख रहे हैं उनको प्रैक्टिकल अप्रोच जो आपके विषय से संबंधित है उससे अवगत कराएं। जी respected doctors, other personality on this site, organizers and audience. I'm thankful to you all to call me here. I have listened the worthy doctors on all the points. They elaborately has put all the things before the audience. There is no dispute about the procedure or the law laid down on this aspect of the matter. In fact, this medical science is a very tricky subject. To know the niceties of this science is a very long procedure. It cannot be understood within a short span. However, since on the other side of the audience belongs to this community, lawyers community, they do come across all these things and niceties of the medical evidence. Someone may be paging on the civil side, another on the criminal side, and they have the opportunity to go through the things this way or the other. What I want to bring before the audience today, there is no dispute what have been said by the worthy doctors. But sometimes, suppose in a case of homicidal death or in case of injuries, there is a dispute. Suppose there is a case of assault. A man is assaulted by certain persons supporting certain types of weapons. The man is to be taken to the hospital, and first of all, he is examined by the doctor in casualty or on duty, as the case may be. The man is having injuries. These are noted in the MLR. Then police comes in, move an application. In fact, intimation is to be sent to the nearest hospital, police station, informing the police that some assault case has been brought in the hospital. And then the police would come and move an application to know whether the man is fit to make the statement or not. If in case man is fit to make the statement, his statement is to be recorded. And then he would explore the method and the way in which he was assaulted. There are certain injuries. Query may be put to doctor how these injuries could have been caused and what type of weapons. Then start the grey areas between the lawyer and the doctor. When the matter is brought to the court, a challan is submitted and the doctor is summoned as an expert witness. Now, in one case, I will quote an example. It was a case of assault. The allegation of the prosecution was that certain persons came in front of the house of the victim, raised their car, yelled, "Come out, we will see you." The man comes out along with his associates or the other member of the families. And then they are assaulted with, I may say, sword, danda, lathi, etc. In one case, so far as I remember, a man was assaulted on the neck by one of the assailants. Doctor examined him, noticed an injury on the neck that were horizontally placed on the neck. The wound was 8 centimeter to 2.5 centimeter in dimensions. Now, what was to be taken into consideration by the defense counsel, the judge, or the public prosecutor? Now, it was a very tricky question at the time of the trial, there was an injury, doctor, on the neck. It was horizontally placed and the dimension was very misleading. That was 8 centimeter into 2.5 centimeters. Had with this dimension of injury, the victim could survive because he was hit on the neck. That was incised wound. Experts' opinions were taken. Certain muscles were found to be cut. And above all, the version of the prosecution was the man was attacked from front side. Was it possible if a man is attacked? And in that particular case, the height of the man who was the victim of the case, he was 6 feet 3 inches in height. And the man who was attacked him, he was 5 feet 8 inches. Now, the question at trial would be whether injury on the neck could be possible or not. Was it a made-up affair, or he received injuries in some other way? Was a question to be thrashed with the help of the doctors or the assistance of the lawyer? To my humble mind, horizontal injury with a sword on the neck of such a tall man was impossible to cause. It could be oblique, it could be in some other way, but to my humble mind, the injury horizontally could not be caused. In such like cases, when we come across, lawyer and a doctor, when we come across, then they help the law and the courts to come to a rightful conclusions. This is our duty. This is the duty of the doctors also. What has been said by the worthy doctors, I'm enlightened. But in such a short span of time, it is quite difficult to understand all these niceties of the evidence. So, my point before the audience and the doctors is, given some discussion is to be held, a pre-hand subject should be given to the audience and to the doctors, so that it may be discussed very elaborately and everybody is enlightened from the subject. There are many examples on this side. I'm working on this side, criminal side, for the last around 40 years. Initially, 5-7 years, everyone is a beginner, and with the passage of time, you may come across certain things and do understand all the necessities of the evidence. So, my respectful submission before the House and the doctors and the other audiences, we do agree with one, we may differ even, but ultimately we are here to help the lawmakers, help to decision makers and the society. With these words, thank you very much.
तालियां कुछ कम रही इस पूरे लेक्चर के लिए, तो मैं आग्रह करूंगा कि जोरदार ताली के साथ धन्यवाद करें हम अपने सभी एक्सपर्ट्स का और हमारे सीनियर एडवोकेट साहब का। क्योंकि समय थोड़ा कम है तो हम कुछ स्किप कर देंगे पार्ट, लेकिन हमारे बीच आने का कष्ट करना और हम जैसे लॉयर्स को एक एक चीज मेथोडिकली समझाना अपने आप में एक बहुत बड़ी बात है। तो मैं धन्यवाद करने के लिए बुलाना चाहूंगा मैं सोनीपत से संजय कंकरवाल जी, जनरल सेक्रेटरी हैं, उनको आमंत्रित करूंगा और साथ ही चरखी दादरी से अजय बागला जी कि वो आए और डॉक्टर मुनीश शर्मा जी का धन्यवाद करें, एक मोमेंटो दे। डॉक्टर मुनीश शर्मा जी, इतने मैं डॉक्टर राजेंद्र कुमार जी का धन्यवाद करना चाहेंगे। झज्जर इकाई से संदीप चौहान जी और यमुनानगर इकाई से रितेश जी। डॉक्टर मुनीश शर्मा जी का धन्यवाद। पानीपत इकाई से पवन सब्बरवाल जी और रेवाड़ी से प्रशांत शर्मा जी से मैं आग्रह करूंगा कि वो स्मृति चिन्ह भेंट कर डॉक्टर गुरमंजीत राय मान जी का आभार प्रकट करें। साथ ही जींद इकाई से सोम जी और सिरसा इकाई से सनी बब्बर जी। ये माननीय सुभाष शर्मा जी को स्मृति चिन्ह देकर धन्यवाद। अब मैं वोट ऑफ थैंक्स के लिए भाग सिंह नेगी जी जो कि सेक्रेटरी हैं हरियाणा अधिवक्ता परिषद के, उन्हें बुलाना चाहूंगा।
आज के इस स्तर में अपने मेडिकल ज्यूरिस्प्रूडेंस पे डॉक्टर मुनीश शर्मा, डॉक्टर राजेंद्र सैनी जी, गुरमंजित मान जी ने बहुत ही विस्तार पूर्वक आपको अपनी बात आपके समक्ष रखी और बहुत ही विस्तार पूर्वक समझाया, बहुत ही बारीकियों से समझाया। तो मैं धन्यवाद करता हूँ आप सबकी तरफ से, अधिवक्ता परिषद हरियाणा की तरफ से डॉक्टर मुनीश शर्मा जी का, डॉक्टर राजेंद्र सैनी जी का, डॉक्टर गुरमंजीत मान जी का कि वो आए, उन्होंने अपना बहुमूल्य समय देकर हमारे को मार्गदर्शन किया कि कैसे कैसे कितनी बारीकियों हमारे लॉ में है और क्या क्या हम उसमें इम्प्रूव कर सकते हैं। तो इनका बहुत बहुत धन्यवाद कि इन्होंने यहाँ आकर हमारे को बताया कि कैसे कैसे किस बारीकियों में जाके हम अपना एविडेंस में अपनी इम्प्रूव कर सकते हैं। और मैं इसके साथ ही धन्यवाद करता हूँ श्री सुभाष शर्मा रफकल जी का, जिन्होंने हमारे कार्यक्रम में आए और इस कार्यक्रम की शोभा बढ़ाई। बहुत बहुत धन्यवाद आप सबका, बहुत बहुत धन्यवाद।
अभी ये सूचना है, इसके साथ ही हमारा ये सत्र तो समाप्त हो गया है और अगले सत्र के लिए 5 मिनट के बाद हम मिलेंगे समरूप के लिए। धन्यवाद।